Good morning, everyone. A very warm welcome to everyone present here. We'll be starting the session very soon. Welcome to AMCON 2020 Keynote Session. We shall begin shortly.
Hi everyone, good morning.
Mm. A very good morning to one and all present here. I am Ruchi Jani from Srimati NHL Municipal Medical College. I would like to welcome you all to the keynote speaker session of Adrenaline Medical Conference 2020. Unfortunately, we couldn't materialize the grand fifth edition that was planned in March due to the unanticipated COVID 19 pandemic, but we just cannot miss the opportunity to organize the fifth installment of our conference. So we bring to you a smaller version of AMCON 2020 virtually. Our first speaker for the day is an alumnus of Srimati NHL Municipal Medical College. I'm pretty sure many of you may know that he is one of the founding members of Adrenaline Medical Conference. He's one of the reasons we are sitting here and attending the keynote speaker session of the fifth installment of our conference. At the age of 23, he became the managing director of KD Hospital, a 300-bed hospital in Ahmedabad. He is the chairman of Indian Medical Association Junior Doctors Network. He has been a TEDx speaker, president of MSAI, head of MSAI UNESCO Bioethics Unit. He was also a part of the IFMSA delegation to the 70th WHO World Health Assembly held in Geneva and was the head of the delegation at the 65th IFMSA August meeting, General Assembly at Puebla, Mexico. And these are just some of his many achievements. So please welcome Dr. Adit Desai, or as we NHLites fondly call him, Adit Bhai.
Thank you, Ruchi. Thank you for having me. It's always a pleasure to come and speak for students at AMCON. It's something that we started with a lot of passion, and it feels really great to see you guys doing so well and bringing the brand up in such a big way. So thank you for having me. It's always an honor. Good morning, everyone. I hope you all are doing well. I'm sure that you guys are preparing for your final exams or your NEET PG exams. But it's great that you're all tuned in today to hear me speak on the topic of the day. Today, I'll start with my introduction. I'm Dr. Adit Desai, and I'm the director of Doc Tutorials EduTech Private Limited and the managing director of KD Hospital. As you all know, I was an alumni of NHL Medical College. So today I'll be talking about the evolution of medical education, past, present, and future. I'll be taking you all through the evolution of medical education post independence to what it is in the present situation and the future of education. Today we will learn how the medical curriculum was formulated over the years and where it is headed today. So if you'll allow me to share my screen, I have a PowerPoint presentation. Yeah, I hope it's visible, Ruchi.
Yes, it's visible.
All right. So in between, I'll also be showing you guys a couple of videos for better visualization of what the future could hold for medical students. So beginning from 1956, post-independence is when the Indian Medical Council Act, the first Indian Medical Council Act, was introduced in the Parliament. The curriculum institutionalization began in 1956 for the purpose of modern medicine. Very less medical colleges were there back in 1956 post-independence. The multiplication of colleges was low and under. There were different 5-year plans, as you all may have studied back in school, that there were different 5 years plan that were introduced by the government. And so medical education was a part of those 5-year plan, and the work was very slow and very few medical colleges were there. So the Indian Medical Council Act was introduced, and hence came into picture the for the first time medical curriculum with in a very structured way. The second landmark milestone came in 1977 with the introduction of rural services in medical education. Now, the reason for this was in 1967, the WHO had recommended certain changes in the orientation of medical education. According to them, medical education had to be linked with various rural healthcare modalities. So hence came into picture the rural services that we have in today's world. So because of this comes into picture social medicine and community medicine, as we call PSM. So that was the second milestone that came in the year 1977. The third milestone was in around 1986, where the Rajiv Gandhi government passed certain bills and laws in the parliament and made the medical education sector private. It allowed private sector to enter into the medical education business, and hence came into picture all these private colleges that we see today. The reason for this is, to broaden the scope of standards to get in private expertise into the medical education sector. Capital education, and as a result, today out of 530 medical colleges, 50% of them are private colleges. Importance was given to a structured curriculum, and outcome-based analysis was introduced. As a result, the current examination patterns and all, the entire structure was formed after 1986. The fourth milestone came in around 1997, where the government made the MCI recommendations mandatory. So whatever the MCI recommended, the colleges had to follow those structures, had to follow those guidelines and protocols. So this is where the uniformity of policies and protocols came into the picture. And in this way, it uniformed the medical education that was being disbursed across the country. The fifth milestone came in around 2009, where it was the platinum jubilee of the Medical Council of India, and they had introduced the National Faculty Development Program. Now, till 2009, the entire focus was only on the education of the students. But from 2009 onwards, the MCI decided that the faculty who is actually educating the students also need a development program. They need to be oriented uh, in colleges, and they need to be taught how to disperse the education. So this was a welcoming move by MCI in the year 2009. The sixth milestone that came was in 2016, when the NEET national entrance cum eligibility test was introduced for UG, PG and SS. So I think this was one of the major milestones which through which all the entrance exams were unified into one, and which made it very easy for the students to not reduce on their traveling, reduce on their expenses for the entrance examinations. And the last and final milestone that was there, which is just came in recently, was the formation of the National Medical Council, which replaced the MCI. And through the National Medical Council, uh, uh, the first move that they did was to unify the AIMS, PGI, and JIPMER exams into INI CET, that is the Institute of National Importance Common Entrance Test. So now medical students are faced with only two exams, which is the NEET and the INI CET. And the other thing that is still under ponderance is the next exam, which basically is nothing but NEET exam, but this will also give you an access to your MBBS degree, along with it being a national entrance exam. So which is still under ponderance. It's not yet live. Maybe in the next couple of years, once they structure the entire thing, once they make policies and protocols, they'll roll it out on a big scale. So I got you from the past to the present on how the medical curriculum started, evolved, and how it is today. I'd like the next thing would be to discuss the present situation, the current situation, what problems we as students are facing, what are our issues, and what can be changed. So the current situation in medical examination requires you to be physically present in the classrooms. Factory education is a term that has come up very recently, which terms colleges and institutions as factories producing students with a single frame of mind, with a single set of points, instead of they having a broader scope of mind, instead of them having a broader understanding of the entire topic. The deadly 75 for students, the 75% attendance, which is mandatory, is one of the only reasons students actually attend classes, so that they are eligible to give the examination, and not because they actually want to attend these classes and learn. Students attend colleges more for extracurricular activities and less for educations today, which is not a bad thing. But education should always have more importance and more focus in colleges rather than extracurricular activities. Both of them are equally important, but it's very important that both of them be equally present, in a student's frame of mind. The real educations are not happening in classrooms, but they're happening in libraries, peer groups, hostel rooms, and chai breaks in canteen. That is where actually students are discussing topics. They're learning from each other. They're learning from each other's knowledge and mistakes, etc., which actually should happen inside the classrooms. Outside the classroom is not meant for education. The real education should happen inside classrooms. Uh, I mean, the professors are not the only people to blame here. The system is such that professors are not well equipped or not well trained with the technology that they have to dispose educations, which I think should be another thing that the NMC could look into. Apart from the National Faculty Development Program, they should also do something in the field of training the professors in the field of technology. The curriculum which we are studying today has not been updated in ages. The pattern of dispersing the education, or the pattern of the exam, has not been changed in ages, and I think it's about time that they change it, so that the new students that are coming in, they'll be taught according to what the actual situation in the society is. The focus today is more on academics, is more on marks, it's more on results, rather than concept clearing and better understanding of the topic. As doctors, nobody is going to ask you after 5 years how much you scored in your first year exam, or how much internals did you get, but it's always going to be about the concept, or how clear you are about the field that you're in, and how much do you understand the entire topic. Today's education is only about chalk and duster, instead of better visualization of the entire thing. It's only about blackboards and chalks is where the professors teach us. They are not well equipped with technology, as I mentioned earlier, and it's not their fault, but it's something that the public and the private sector together can form a bridge there. There is no focus on clearing doubts and solving queries. It's always about finishing the course in time. All of us have been to all these classes where 500, 800 people are crammed into a single hall, and when one professor is teaching, all of us are taking notes. That is not how ideally education should be. It should be more about how to solve every individual student's queries and doubts, so that at the end of the day, you are sending out students into the world and all of their concepts are clear. And there's always crowded halls in colleges, in these tuition classes. There are always crowded dissection halls where a student does not know exactly what he's or she is being taught, and the focus is always on taking notes rather than to listen and to learn and to clear your concepts. Online education is something that has come up very, very recently in the last 3-4 years. It's something that is very upcoming. this is a topic that I'll be discussing later in this presentation. But for now, I think we'll be moving towards what the future of health, medical education holds for us. The future is actually without borders, and it's in the hands of students and technology, and both of them have to go hand in hand. So the future of medical education holds a lot of possibilities for a medical student. And instead of me discussing these, I'll take you guys point by point through very simple, easy to understand videos that I've found on YouTube. Uh, I'll take you guys point by point. The first one being augmented reality, which is for better visualization. By definition, what augmented reality means is real time use of information in the form of text, graphics, audio, integrated with real time objects. Now, this is very difficult to understand, but let me take you through a simple video that would help you get more understanding.
Number 6. Virtual and mixed reality for medical education.
Imagine pure...
Sorry, 1 second. Yeah. So there's a real-time a human body in front of you, which with the use of technology, you can see any body part, any organ, take it out, see it 360 degrees, read the text on that particular organ. For anatomy, you can just break up parts. Here, as you see, I'm breaking up parts of the skulls and to see individual bone of the skull for better visualization from inside and from outside. Here there's a virtual cadaver on the table where you can see individual sections of the body without there being a physical body, without there being a need of a physical cadaver in front of you. Every student can have their own cadaver in front of them without their, instead of there being one cadaver in front with 20 people around. Here, while you are reading notes,
is composed of 8 carpal bones arranged into 2 distinct
you can visualize the bones in front of you, the organs in front of you.
These small bones provide flexibility to the wrist. There are 4 bones in each row.
Imagine this being installed in each and every library of the country. And while you're reading, you have a virtual cadaver, a virtual organ and bones in front of you. The second point will be a virtual reality. Now, a lot of people always confuse between AR and VR and the difference between AR and VR, which I think we'll be clearing in our next video. Well, what virtual reality basically is it's a computer-generated simulation in which a person can interact with artificial 3D environment using electronic devices. I'm sure a lot of you have seen those VR glasses that you wear and you install your phones. So that is what virtual reality is, that you use electronic devices to enter into a virtual reality that is not yours. And currently virtual reality is being used predominantly in the gaming sector and not in the education sector. But I think it's the future of education sector. I'll show you a very simple video for that as well.
Number 6. Virtual and mixed reality for medical education.
Imagine
very easy video by Cleveland
the
Clinic.
Human body without an incision or a scope.
As you can see, the person is wearing a glass
without touching it. Using a headset, controllers, and innovative technology, it's possible to navigate human anatomy through virtual and mixed reality. These realities can provide medical training and procedures, techniques, and equipment use, as well as simulate patient interactions in a more immersive and realistic way. As the VR/MR trend grows, pilot programs involving these technologies for the education of medical students are being implemented worldwide. Though not a replacement for hands-on practice, virtual and mixed reality are increasing situational experience. Giving students an opportunity to practice with computer simulation is a low-risk alternative and in extreme cases, can prevent patient harm. The technology's new applications have many dubbing virtual and mixed reality the new reality.
So, I think virtual reality is something that not just medical students can learn from, but it can also be used in real time by doctors who are performing surgeries to create an entire simulated environment where you input a patient's information, a patient's reports, and CT scans, MRI into the software. You can virtually create the patient's body, and you can dissect the entire body to, have different permutation combinations of. Different modalities of treatment to see which one is actually going to work for the patient. And instead of what happens today is you perform the surgery and then there are complications which you have not foreseen, and that puts the patient's life in risk. So virtual reality and AR can definitely help not just medical students but also practicing doctors in their fields. The third, and I think the third one, which is Anatomage and Spectra, these are two products out there in the market already, uh, which are basically nothing but a virtual cadaver in front of you. You can cut, you can take slices, you can see different MRIs and CTs of different parts of the body, and it's your personal cadaver, a personal cadaver for every student. Of course, it's quite expensive right now to buy an Anatomage table, but I'll show you what exactly it is for you all to get a more clearer idea.
The Anatomage table is an interactive display system for anatomy education.
It's a 6 feet
It's capable
table,
of providing full body anatomy
a real-time
visualizations
virtual
on a
body,
life-size scale.
where you can see the musculoskeletal system, the nervous system, the circulatory system.
So this is a skeleton of a real patient. You took all the tissue off. So I cut across here. If I press there, I get rid of it, and I can turn.
You can visualize it from inside, from every side that you want to see the organ.
Structures can be toggled by tapping the on and off icon next to the desired structure, category, or system.
So here you can see the entire circulatory system of the human body without any bones and organs for better clarity, better visualization of the entire human body.
There are ways you can dissect animals in here. There are all different kinds of disease states
you can also dissect
teach medical
different
students
animals.
how to evaluate the lungs for cystic fibrosis or pulmonary fibrosis or tumors.
It also simulates an operation table as if you were in front of the patient or cadaver. The touch interactive controls are natural and intuitive, again strengthening the concept of being present with a full-body life-size patient or cadaver. The table comes loaded with a full-body CT scan enhanced with custom anatomical models. What you see here is the skin model. The scalpel tool can be used to create custom cutting planes, and then it can be rotated to see the volume rendering underneath with the digital models.
To get all the latest news, visit www.beholdthefuture.com.
So imagine having one of these in your college, in the dissection hall. A student can just go whenever the student wants, dissect the virtual cadaver, see whatever organs, whatever bones that they want. And what happens today is once you miss out on a body part, that body part is gone forever. Once you dissect a body part and it's gone, then there's no other option for the student to go back and learn from it. You just have to learn from the bone set that you have. But here you can go whenever you want, how many ever times you want to the department, dissect whatever you want, see any organ, any bone as many times as you want from each and every angle. So I think this is something that is possible in the very, very near future. This is something I think we can see in the next 3 to 4 years in most of the colleges across the country, hopefully. The future of the healthcare, what as discussed in the present situation, the issues that we are facing right now is the lack of personalized education. Not every student is able to cope up with the time, and not every student is able to clear all the concepts. So I think personalized education, where 1:1 ratio is provided by every college to every student, is something that I feel would change the face of medical education entirely. Smart classroom, as discussed earlier, most of our times goes into taking notes, is to draw figures or to write what the professors are dictating. But I feel the professors focus should be on teaching, and the students focus should be to learn uh, what the professor is teaching, and automatically get the notes, get the screenshots of whatever the professor is writing on the screens, is something that will majorly help every student to just focus on what is being taught in the classroom rather than what you're supposed to write and learn later. The third thing I feel, a mentor program is something that can really help every student, where a group of students uh, are given a mentor from the college, say a PG resident or the professor itself, so that there's always that communication happening from students and to the faculties, so that there's no gap in between students and faculties. Third would be virtual classrooms, which I think is in the distant future of education as whole. I feel institutions and infrastructures will be a thing of the past. I think virtual classrooms is going to be the future, where there's no physical need of any attendance. So the student does not have to always worry about where he or she is. You can attend your classes from wherever you are, and you can always attend these classes later on, and the entire college syllabus and faculty can be at your fingertips. You can see what lectures you want whenever you want and wherever you are, and I think giving the students that freedom, or that added value, is something that a student always requires. We, as a student myself, we never like to be bounded by a timeline. We would want to do things on our own time. Of course, we have to do those things, but on our own time. And I think that will definitely be the future of medical education. As discussed, online education is something that I told you that we will be discussing later in the presentation. So online education is something that has come up recently in the last 3-4 years. There are a lot of applications and websites, and people use YouTube as a medium to disperse education on different topics for different examinations. So there are certain benefits of online education, and there are certain gaps that are there in online education as of today. The tech is new, of course, and hence expensive. It's anywhere ranges from 40 to 45,000 per student per year, which I think is extremely expensive for medical students. But towards online education, which will make all these other applications today obsolete. The concept of personalized education will be implemented, and every student will be able to talk to the teacher of his or her choice, wherever that professor or the student is. A student from the east can just by click of a button talk to a faculty in the south, and discuss whatever topics they want to discuss, any MCQ that they have any doubts with, etc. The guidelines and SOPs will need to change to accommodate the increasing curiosity of medical student fraternity. Currently, any online platform that is there is a one-way mode of education, where the faculty is teaching and the student is learning. But we'll have to pave the way for a two-way education, where there's also feedback coming in from the students to the faculties in real time, and I think this will really benefit the students in the future. I think the exams that that are currently focusing only on marks and only on how much you're writing will completely shift to the exams focusing on only concepts. How well do you know the topic, or how clear you are about the particular topic? Going paperless with all our examinations is also something that I see happening in a very distant future, but a lot of countries in the world are moving towards this. India, of course, is not there yet. practical education of cases where the actual revolution will take place. As we saw in these videos, these the technology is not just for medical students, but it's also for PG residents, where there'll be virtual case presentation, where you do not need an actual patient physically in the hospital to present your case. You'll be able to present your case virtually as well. Students can try different permutations and combination on a virtual patient and see the result without any risk of complications. You can try different modalities of treatment, different drugs, different diagnosis, and etc., without risking, the without risking any complications to the patient, which exists in today's world. So you cannot experiment with a real patient, but you can definitely experiment with a virtual patient. Uh, you can see inside out the human body, as we saw in Anatomage, or virtual and augmented reality. You can see inside. You can see from whatever angle you want to get a better idea of the depth and clarity of the organ and the bones. And I think artificial intelligence is also something in the distant future which will help to assist students and doctors to understand radio diagnosis. But for artificial intelligence to develop, it needs a lot of data which keeps on changing, and it's different from patient to patient. So that is something that will take time to catch up, but it will definitely be a good assistant to the doctors and the students in the future. I think that brings an end to my short but sweet presentation. That is the evolution of medical education in India in a nutshell. I think there's still a long way to go to achieve the goal of the ideal educational institute, which will require the amalgamation of private and public sector, but most importantly, the acceptance from students. Thank you very much. Thank you for spending your time on a Saturday morning to hear me speak. If you guys have any questions related to the past, present, and future of medical education, I'd be more than happy to answer you all.
What are the cons of this thing? Like in the future, if we are not going to practice it over a real body or anything?
No, so I mean, I by that I don't mean that we completely stop practicing on real bodies. Of course, real patients, real case presentation will always have to be there. But just in case a student is curious that, oh, what if I do so and so thing in this patient, what will happen? Or what if I try this modality of treatment, what will happen? In a real life situation, you cannot do that. We are not allowed to do that. We're bounded by our ethical guidelines. So the virtual case presentations will always be an assistant to the student. It will not be the only thing. It cannot replace the benefits of practicing on a real patient. So it will always be an adjacent thing, a complementary thing to the real patient.
Okay.
And of course, all the technology that I took you guys through, that will never be the sole thing that will be there. It will always be complemented with the real life practice, the real life patients, real life cadavers, because of course the student has to also touch and feel. Apart from just visualizing, the student needs to feel how it feels to dissect a cadaver, or how to suture a real life tissue, etc. So all this technology will always be an assisting partner in the current education system that we have.
Okay, thank you. Anyone would like to ask any question? There's one question. Is there any scope of sensitizing the fraternity out here in India by organizing workshops by these technologies in near future?
I think we as a country, at least in the education sector, have been lacking behind in promoting these technologies out there. We are still very primitive when it comes to dispersing education. So I don't expect it from the system to promote these technologies, but I think as students, we should stand up and demand for these technologies, because we would know and feel the benefits of these technologies. So I think as the student fraternity, we should stand up and ask the government or our colleges to bring these technologies to us, because that's all we can do. We cannot, all these technologies are extremely expensive, so of course we'll need help from the government and the colleges. But definitely by organizing something for the faculty, something for the students and governments, would definitely help them in understanding how it can be beneficial to us. So we will have, as students, we will have to take the charge of the entire situation.
Okay. Another question is, what do you think about next exam means? After how many years next is going to be conducted?
So next exam is basic nothing but it's NEET exam. It's National Entrance Cum Exit Test is what it stands for, which will be conducted after you give your final year exams. It will be immediately conducted after your final year exams. It has been in the pipeline for the last 3 to 4 years. It has been vehemently opposed by the Indian Medical Association and the medical student fraternity, because it is just an added burden to the medical students to also. So basically, you have to clear the next exam in order to get your MBBS degree as well, which would, make all the other exams that we give, the first year, second year, final year exams, obsolete. So either you take away all those exams from us and give us just one exam, or there's no point in giving us the next exam, because that is just adding another exam on our plate, which we do not need. We already have all our other exams and the NEET exam, which I think works perfectly. But the NMC, that is the National Medical Council, is being headed by bureaucrats and not doctors. So that, I think that is something that as the student fraternity, we should definitely oppose, because we cannot expect IAS, IPS officers to understand what medical education is and how it is going to be taken forward. I think it'll, what with the current situation, I think in 1 or 2 years it may come, but we will have to keep on opposing it, definitely.
Okay. Another question is, how would you like to modify the current medical education scenario?
As discussed in the presentation, I don't think the current classroom education practices is working. I don't think it's been working for the last 10 to 15 years. I think that you need to definitely start promoting online education to students, and of course, as a complement to the classroom education, I think teachers should be, given the technology and the, the tools to make the students understand the topic better. I think teachers themselves are not very well equipped with the things that they should have, like a lot, and most of it, I think, is related somewhere around technology and investing in technology. Of course, that is again is the call of the medical colleges and the government policy makers. So I think investing in technology, equipping the professors with technology is how we can move ahead in the right direction.
Okay. So next question is, how to keep ourselves in the real practice amidst online education?
So as I said earlier, online education will never be the primary thing. Online education will always be the complementary thing. The real practice is where your actual focus should be. And so even currently online education, how students are using it definitely in their free time or after their their day is over, is just to keep themselves updated or to clear their concept. So it will not be the only thing that you will be doing, but it will be a complementary thing to the real practice.
Okay. And the one is a bit controversial, but how much hindrance or support do you think the political system creates for the advances in this sector?
So I don't think the political sector has any issues with providing these technologies, because they have nothing to lose. I think it's just the bureaucratic, the entire environment that has been created in the country, that whatever is happening happens at a very slow pace. At least in the education sector, whatever is happening very slow. So as I said, as students, we'll have to stand up and demand what we want, because if you're gonna wait for all these technologies to come in, probably it'll come during your children's time. And as I said, the students will have to stand up, demand for it, or there'll have to be a parallel education system, which will complement the current governmental education system, which we only will have to create.
Okay. So next question is, since these technologies will take a lot of time to be in the curriculum, how can we solve the issue of lack of teaching staff in colleges in India? Because even if we have online education, we need sufficient teaching staff.
Again, I think this is where the government's role would come in. I think the teachers in this country, not just medical teachers, but any teachers in this country, are extremely poorly paid. Of course, any person or would want at least a sufficient basic amount of money to sustain, or they'll have their own dreams to fulfill. I think they're extremely poorly paid. I think that is where we need to start, because to encourage people to take up a job of education, you will also have to pay them uh, what they what they deserve. So that is where we'll have to start. I think there are lots of professors and students even today who are very interested in educating other students, or educating their peers, but the government will have to incentivize the entire teaching sector in order to attract more people to take that job.
So next question is, your views on how medical education was handled during the pandemic.
I think the medical colleges, to be very honest, I don't think they did a very good job in dispersing education to medical students, because all students had turned to private companies, to online apps and websites to educate themselves. I don't think the government or any private or public college did anything to disperse college. I think for them it was more of a vacation. Uh, but that time has passed. I think colleges are going to reopen very soon. This is definitely something that the students in their colleges will have to take it up with the management, that whatever they did wasn't very satisfactory, but because of the presence of online apps and websites, their education wasn't hampered.
So next question is, how can we reach out to all the students amidst online education, because rural areas still face accessibility issues?
I think this is also something where public and private sector will have to come in. There are a lot of multinational companies that are trying to increase the accessibility to rural areas, investing more technology in those areas in terms of having good quality internet and giving good quality equipment. But this is an issue I think we as a country have to solve, not just in medical education, I think also uh, in urban areas, in the poor communities where they have internet but they don't have the tablets or they don't have the smartphones to see online education. So I think this is a very broad topic with no particular answer, but this is where the entire everyone has to come together to help out people in rural areas and in urban areas with in the poor community.
Okay. Further, we have three questions. Also, audience in the live stream on YouTube can also ask questions. Okay. So, for the next question is, according to you, who has more knowledgeable, good doctor, the students who completed their MBBS from any foreign country or from India?
I don't think. I mean, I'm nobody to comment on this, because I mean, if you're comparing apples to apples, it's a very difficult answer. I mean, a doctor from a foreign medical college can be smarter than a doctor from the best college in India. That depends on student to student and every individual student's competency. So I don't think there's any particular answer to this. I mean, anyone can be smarter.
And last question: online PG coaching or offline PG coaching, which is better according to you?
In my time, I mean, I've done both. I also sat in an offline PG class in a big hall with 800 students and barely any space to move in a 14-hour lecture, as opposed to watching a video of my choice, of my faculty's choice, of the topic of my choice, as many times as I want, and from wherever I am, on my bed or in the library, anywhere. So I definitely think online PG coaching is the future and is going to benefit students that offline PG coaching will never be able to do. Online PG coaching is where you'll get personalized education, is where you can get personalized education. In offline, it's, at least in the current system, it's not possible. So I would definitely choose online PG coaching.
Okay. So I guess we are done with questions.
Thank you.
Thank you so much, Dr. Adit Desai, for being here with us and for this informative session and throwing us light over the future of medical education. And now I would like to request Vedanshi to take over the session. Thank you so much.
Thank you.
Thank you so much, Ruchi. Our next speaker is a senior consultant neurologist. He is the professor and head of Department of Neurology at KM School of PG, Medicine and Research and Sheth VS General Hospital. He is the executive committee member of Indian Academy of Neurology. In 2016, Honorable President of India awarded him the fourth highest civilian honor of Padma Shri Award for his contribution to medical sciences. He is a multifaceted personality, a teacher, a musician, an orator, a well-read scholar, a prolific speaker, a scientist, a philanthropist, an occultist, as well as an administrator. He is known internationally for his research between fasting and meditation. He has been interviewed by various television networks like BBC, CNBC, Discovery Channel, and many other international and national channels. He was the organizing chairman of the Indian Academy of Neurology Conference, which was a big national event held in Ahmedabad. He has delivered innumerable keynote lectures in India as well as in the USA, UK, and other countries. He is an active member of several national, state, and international level neurology bodies. He has his own library, which has approximately 9,000 books on philosophy, ethics, religion, and culture. He has given selfless medical services to more than 5,000 saints from different religion and different sectors. Enlisted in the Power 100 list of Divya Bhaskar, depicting 100 powerful persons of Gujarat, and credited to several papers, publications, and books, awarded with the International UNO Award. Please give him a warm welcome to the nationally reputed neurologist, Dr. Sudhir Nisha.
Thank you. Thank you very much. Thank you very much, Vedanshi. And it's really a matter of great pleasure and honor to be with the students who are actually my most beloved class of medical fraternity, because you are the present and you are the future of medicine. And today's topic that we have chosen is specifically to give you some words of wisdom, some pulse of wisdom that might help many of you in the direction that you take further. This is something which is not in your books. This is beyond books. None of the things which I'll mention, because it's a matter of practice, matter of art. And therefore, I think it would be really very nice for you to take notes of all this. I think we are before time, and Adit has done a very good job. He has left 10-15 minutes in balance for me. So we'll use it for question answer if they have. But I will have a presentation of nearly 50-55 minutes or so, which I think should be okay. So kindly give a nice listening. May I share the screen now? Yeah. Okay. Is the screen there, Vedanshi? Are you able to see the screen?
Yes, sir.
All right. Okay. Let me go to yes. So as students, your major interest would be you're having some anxiety what will be happening to you in the course of your life. Would you be a successful doctor, a physician, or a specialist or surgeon? That would be your major concern. And I think it is very rightly so, because everybody wants to be famous, rich, and excellent. But your books only teach you how to be academically do it. Maybe how to get good marks, as Adit was saying, and there's flaws in the system also. But excellence is something a different ball game, and those of us we are who have been practiced more than 30-35 years have watched our lives and compared with the other friends, and we realize that excellence requires something else than academics. Excellence in medical practice may not depend only on academic success. So that is the bottom line. So I dedicate this talk to my stalwart teachers, Professor Singhal, Dr. Vadia, Dr. Yasu at Houston, and Dr. Shorwan at London, where I studied in different aspects of neurology. And of course, I dedicate to you, my beloved people, my students, that, wisdom, character, kindness, and high caliber research, these are the core things that you have to learn in your life. I'm fortunate to have these kind of professors. So the first question that comes to our mind is, what are the key dimensions of a great physician? Key dimension of a great physician, basically its character. Advanced knowledge, updated knowledge, whether through virtual classes or ideally through the practical room classes, and bedside medicine is the most important. Nobody can replace bedside medicine. Sincerity, clinical judgment, innovation, research, curiosity, communication, compassion, and ethics. Unfortunately, this is not mentioned in your book except for this part, knowledge advance. So, first of all, we talk about the ethics. Ethics is what? Ethics is knowing the difference between what you have a right to do and what is right to do. What you have a right to do and what is right to do. That difference, that is ethics. So, exhibit appropriate professional behaviors, honesty, compassion, care, and confidentiality. These are the key words. Demonstrate a commitment to excellence and always stay curious and innovative. This is how you can really stick to the high standard ethics. Excellence is your commitment to yourself. Communication is the vital key between the doctor, patients, relatives, and colleagues. So, after the ethics, the most important denominator of success or excellence is communication. It's a lifeline. Respond to patients' behavior. When you are going to the wards, many of you must be in second and third MBBS, you must be exposed to ward patients. Except for this corona time, you will be going there. And there, you see patients don't utter sometimes, but they have a lot of things written on their face, in their eyes, in their mouth, on their expressions. So you should respond to all that. That is the art that we have to learn. So what you have to do? You have to use simple words that they understand. Use proper body language. Lean forward. Talk in a very polite manner. Don't tell in a hurry and go, oh, this is fine, don't worry. Just spend a minute or two and explain them. Give them time to digest. Take sufficient pauses. Let it be dialogue. Not only you should say, but let them also respond. It should not be a monologue. I know these are two different lectures, success and happiness, and each of them require at least 1 hour, and I'm going to compress. So I'll be little fast, but I have a lot of faith in all of you, your understanding and intelligence. So I'm sure you will grasp the words very quickly. So on patients' trust and confidence, always greet your patient and relatives with a smile. Okay, don't take your face, which is, quarrel with somebody and then go and just be very calm, quiet, and wear a smile on your face. If they are happy with your attitude, then they usually blame it on God and the karma in case of adverse problem, something goes wrong. If you are nice to them, this will save you. So attitude is most important. You don't know which case turns out into emergency and have an unanticipated outcome. Howsoever great you may be in your clinical skill or surgical skills, but if you are bad in behavior, anything goes wrong and you are in a soup, and you are knowing, you are aware that lots of cases, suits are filed in court just because of this communication issue and ethics issue. Third is knowledge acquisition. There is no alternative to great knowledge. It's a core competence. The eyes see what the mind knows. So you must know everything. Read textbook, review articles, journals, research, networking, talks, online teaching, coaching, teach the other fellows to stay to best way to revise is to teach or discuss among the friends. Knowledge-based hierarchy does not believe in any holidays. So just learn whatever way. Now that online platforms are available, so as far as the non-clinical aspects of teaching are concerned, many of them you can learn on the online platform, as Adit was very nicely discussing. I'm very happy that Adit grew up in front of me and he is now turned into a very mature man running such a giant organization. So this is what I believe. I believe in you guys because you are the future and you are the present. So try to grasp some of the points which your senior is talking to you with lot of experience. So all of the words that I am saying have each of them have meaning. Clinical judgment, demonstrate clinical reasoning, make sound diagnostic and therapeutic decisions, incorporate cost awareness and risk benefit analysis. So this is how your clinical judgment is very important. When you see a patient, there may be 4 differential diagnoses, but you have to apply in the given situation what suits the best and how best you are treating. Treatable diseases should be most important. And when you are having not shared your diagnosis, go into more depth of history and clinical findings and add up with the investigations. See, knowledge and evidence-based practice that you have to combine. It is not only evidence-based practice, not only knowledge-based practice. So you recognize there are practice uncertainty and there are knowledge gaps in clinical medicine. Everything is not certain. Clinical medicine is an art, and everything is not 1 plus 1 is equal to 2. So when you focus on information, then you'll be able to gather this knowledge. You just filter it out and that will become knowledge, and from knowledge if you distill, the wisdom comes out, and these are the pulse of wisdom. So all that information may not be necessary. 90% of information will fall out, and then from that knowledge, and then only one line will be wisdom. So integrate evidence into decision making in your practice. Keep yourself continuously updated. So if I revise, the core competency of the doctor is a character which is formed of ethics, knowledge, sincerity, clinical judgment, innovation, curiosity, analysis, and communication, and compassion and humility. Now, before we embark to the 10 success laws of success of medical practice, or 10 laws of excellence in medical practice, I want to reiterate 2 important things. The law of success is the law of people. In today's day, individual practice is not going to help you. You have to think about group practice while you are still in your undergrads or postgraduate, and when you are planning to practice in a couple of years, you have to make a group of friends, like-minded people who, as for example, a cardiologist is doing DM card, then you should have one interventional guy, one clinical guy, the another fellow is the arrhythmia guy, and another is the, different other subspecialties. There are a lot of things now. The procedures are coming up like atrial appendage blocking. So if you make a group of 5 people, then your life will be easy and you'll be able to get a large group of patients. In a brain-based economy, best assets are people. Only by attracting the best people will you accomplish great needs. Team building is vital for professionalism. So create an environment where the best, the brightest, most creative, intelligent people are attracted and retained, and they should be given enough power, empower them to shine out. So this is called law of people. So this is a very important law. And another important law is law of time. Respect the time and time will respect you. When I was studying in UK, my professor Marsden, he was 57 and I was only 30 years. So when I met him, I saw that he had created enormous amount of literature. Lots of monograms belonged to him. So one day, when he was in a very good mood over coffee, I asked him, so what is the reason why you are so successful? Then he gave me these 3 laws. Respect the time and time will respect you. Don't waste your time in unnecessary things. Of course, time with friends and family and quality time is important for your hobbies and your creativity. But useless waste of time at the cost of your own development is nonsense. And I did this in my life, and whatever little success I've got is because of following these three laws. The second thing he taught me: do only those things that you only can do or enjoy doing. I'll give an example. Like, I have a driver from day one because I don't like driving. I am a driver, but I'm not a very good driver either. So I kept a driver, even though it was the start of my practice. Because of his insistence, Dr. Marsden said to do so, because he also did so. So I was saving roughly 50 minutes of my driving time, and at the back, in the back seat, I used to scribble down, write, conceive, and draw certain figures and charts, and also create medical literature. And the books that I wrote, 6 books, I can tell you, are just nothing but the product of this investment of time. So third thing is, decide on whom to meet, why to meet, where to meet, and for how long to meet. Don't allow people to intrude in your life just like that. If you have some work with somebody, go and meet him at his place. Don't call him at your place, him or her. Otherwise, when he or she will be in his or her hand, and you will be at mercy of the person. If you have gone to somebody's place, it is you who will get up and say, "Sir, okay, thank you for your help," etc., etc. Like that. Why to meet? You chart out where to meet and how long to meet. So this is the law of time. Now we come to the basic thing: 10 golden rules of achieving excellence in medical practice. What's a great physician? Great physician or excellent physician or surgeon is eminence-based, elegance-based, eloquence-based, and evidence-based. He walks like a king. He talks like a king. He has elegance. He has a grace, and he has knowledge emanating from his or her face. And he, of course, follows evidences. Successful medical practice may not be dependent on academic excellence. I remind you. So if you are first in gold medalist, that doesn't mean you will be successful in practice. I have thousands of examples where the gold medalists are in a rotten place, and the middle guy is in a top race. So that the reason is these 10 laws. That there is no substitute to knowledge, sincerity, honesty, and hard work. Believe me, there is no substitute to knowledge, sincerity, honesty, and hard work. And this is my Professor Vadia, who is the example, who is a Padma Vibhushan. The patient is in the center of all acts. There is a law of number 1. Just focus on good health outcome. All other aspects are secondary. Please do not adulterate the patient outcome with anything. What I mean by adulterate? What I will earn from this patient, how I will benefit my colleague, or how I will get kickback, or this or that. No, nothing doing. Ethics, doctor-patient relationship forms one of the fundamentals of medical ethics and healing process. So please do not adulterate anything. Just focus on how I can help this patient in the best possible way from all angles. Not only from medical recovery, but also from social and financial aspects also. If that compassion and that ethics flows from you, you will be atop, you will be ahead of all of your colleagues. I will apply for the benefit of the sick all measures that are required, avoiding those twin traps of over-treatment and under-treatment or therapeutic nihilism. I will prevent the disease whenever I can. You know that prevention is always preferable to cure. If a patient of stroke comes to you, you should find out why he had a stroke or a heart attack, and then find out the risk factors and try to prevent second stroke. Also screen the family members. If they are high risk people, there are more than 1 or 2 strokes or heart attacks, screen them and find out risk factors for them, maybe lipids or homocysteine or EPLA or whatever, and treat them all before the disease happens. That is what is the prevention aspect. One of the prime duties of physician is to prevent disease. Second law is talk less and listen more. Do appropriate gestures. Be a great listener. Professor Singhal, my teacher, used to listen 70% of the time, and 30% time he would talk. In 1 hour interview with the patient or meeting with the patient, 70% of the time patient would be allowed to speak, and only little he will speak, wherever required questioning or some history-related things. So appropriate gestures, be a great listener. We are always in a hurry to talk and say and cut down the patient. You will just cut his sentence. Don't do that. Just listen them very carefully. 70% of the diseases are psychosomatic. They come sometimes and pay you just because they want somebody to listen to you. So here, listening is a beyond hearing. You are trying to process, and comprehension is your visionary aspect. Same will see, but when you observe, it is beyond seeing, and then visualize. So what is, why he is doing all this? So all these things would be most important. Eye contact, gestures, these are the very important things. Answer their questions very carefully, educate them, counsel them. If required, pat their shoulder. Don't worry, I'm here, you'll be fine. Don't worry. So communicate effectively. Please do not turn down. Please do not turn down the patient or relative or any involved doctor. The role as a healer. So third rule is don't turn down. You be very, very compassionate. Role of as a healer is humility and compassion are very important. Always say the truth, but in a presentable manner. I have come across so many surgeons and physician colleagues who just say, hey, there is a 50% mortality, and if you want to come, then it's fine. Otherwise, you may get this paralysis, this, that. Now, it may be high risk patient, but there is a way how you break the news. So, and at the same time, if they have some demand like this investigation or that investigation, listen to them and then carefully counsel why. In a case of neuropathy, CT scan of brain is not required. So if they come with this kind of unrelated demand, you may explain, look, this is muscle and now, and where we heard CT scan talks about brain. So maybe it is waste of money, and I think it is better we do EMG now conduction in a very amicable manner. So this is a matter of culture also, not only teaching, how your texture is, how your family has brought up you, how your teachers have taught you, what environment you are living in. That is important. Compassion is very important. As a doctor, if you don't have compassion and that doesn't reflect in your care and helping nature, then you are not a good doctor. There is no nobility. You are a commercial man then, just distributing healthcare with the in the return of money. No, if you want to excel, then you have to be compassionate. See, treatment can be of four types. Somebody comes with fever, you can give metacin, that anybody can do. That is a symptomatic cure. If somebody comes with fever and if you are slightly trained, you might give treatment of malaria or whatever, and then that is a little relief of the disease. That is treatment of disease. Then we come to third level, is management. So if you have a stroke, then as I said, you find out why he had a stroke and how to prevent that stroke, etc., etc., and accordingly you treat and prevent further stroke, and also do physiotherapy, speech therapy, and also take care of depression. So that is a management, a very, very professional doctor can do. But if you want to be healer or excellent person, then you have to do lot many other things like compassion, care, healing, all those things you have to add. How is your family? How I best can help you in a limited kind of frame. We have to go a little beyond and look into the eyes of the patient, heart of the patient, and try to heal the disease, console the body, mind, and the soul at all three levels. I'll remember that is art to medicine as well as science, and warm sympathy and understanding may outweigh the surgeon's knife or chemist. That is very important. Please remember that the patient is always right, patient is always first. So when you are taking optimal decision, there may be clinical data, there will be research evidence, so that is evidence-based medicine, but we are forgetting patient values. We are not taught to look into that. We must take care of all those things, what he feels. So discuss with him or her the decisions, and that is how we should do. What is the starting of problem? Why there are a lot of cases and why there is violence against doctors, which all of us are concerned. One of the reasons is the problem starts when your attitude is one or more of the following. This is not my job. I am too busy. Patient is too demanding. You're asking stupid things. These are the reasons of inviting trouble. So don't do this. If the case is difficult, right from beginning, explain them very kindly, politely, write it down on paper, take the consent and explain them properly, or also offer optional opinions. Never cut corners. Never cut corners due to time and money. About two factors are common drivers of cutting the corners in medical practice. So don't do that. Doctors should be rewarded for quality care and not for cutting corners. I don't have time, so I won't be able to justify these. Or if the patient does not have money, therefore I won't be able to treat. These are all wrong things. Don't focus on patient's finance. First, manage the disease and offer optional disease. If the patient doesn't have money, offer them, you go to government hospital or municipal hospital, etc. But first you attend the patient and manage the disease. Don't discriminate between the patient. No, this is poor patient, this is rich patient, this is this caste, this is another caste, this is my cheat case, this is another cheat case. This is wrong. A real excellent noble doctor will never discriminate between the patient. For him, everybody is same. Always remember, it is not the fever chart or cancerous growth that has to be treated, but ailing, sick human being is in front of it. We just look at the chart and just no, look at the patient, take the pulse, look into his eyes and discuss with him and give him compassionate pat. That is what we have to treat. Don't look at the charts only. A good physician treats the disease. The best physician, excellent physician, treats the patient who has the disease. Very important. Very important. And William Osler is the guy who jotted down all these lines. One's illness is not confined to oneself, but may affect the person's family and economic stability. So our responsibility also includes these related problems when providing adequate care to the sick. Fifth, never hesitate in referring to an expert for second opinion. I will not be ashamed to say I know not, nor will I fail to call in my colleague for expert opinion. Because sometimes skills of another expert or senior or more trained person is required. Now there are days of subspecialty. In my days, there was general neurology, then came stroke, then epilepsy, infection disease, headache. Now headache is a specialty. Demyelinating disease. There are 12 major lines. And now in demyelination, we have adult, pediatric. In adult, we have now only central demyelination, peripheral demyelination, and so on. Tomorrow, a right type specialist and left type specialist, everything will be like that. So science is expanding, knowledge is expanding. You can't keep pace with everything. So don't sit on the patient. If you don't know, call somebody else. In the interest of well-being of the patient, or for having a different viewpoint, or for learning, or for sharing responsibility. There are 4 reasons why you can involve an expert. It's okay to say, I don't know. Even at this stage of my life, I tell so many times, no, sorry, I don't think I'm the right guy to treat you. I'll send you to the colleague or some person in Delhi or Mumbai, etc. And don't be afraid to challenge the experts also. Sometimes you learn from the expert, observe them, but seek out them as mentors or partners. But the expert may also have made mistake or leveled out. So don't, success doesn't come from blind obedience to someone. So keep up reading and also try to see whatever has been advised by expert is correct or not. Most important rule is number 6, do not criticize your colleague from your pathy or doctors from other medicinal system. You know, what is the biggest crime on earth? To break somebody's trust on some person or some faith. Do not break trust or faith of your patient on a doctor or a medicinal system. Somebody may believe in Ayurveda or homeopathy. I usually tell, look, I am not good at Ayurveda or homeopathy. It may be good if you wish, you can do that. But look, with my medicines, if you combine, there may be some untoward reaction. I don't know. So I personally don't advise, etc., etc. I don't say, oh, these are all bogus, they are quacks or cracks. No, nothing like. I don't know anything. How can I comment on them? And then millions of people all over the world are following different paths. How can they all be wrong? And you know the flaws of our own medicine. How many flaws we have in our system? So you may give your opinion, but in a presentable manner. Please do not opine if you don't know. Always work in a collaborative way. Constructive criticism can be beneficial to everyone. Respect all other colleagues. Sometimes we criticize our own colleague because we want to be presenting ourselves, oh, I'm the real expert. Now, the relationship with a colleague is more important than with the patient. A 5-day-old patient who has just come in your contact and a 15-year-old colleague with whom we have to have a longer inning of life. So, whom would you choose? So even if your colleague has made mistakes, don't utter a word. Uh, I don't say that you want to just cover it up, but you are not supposed to. Even they ask, they say, I don't know, I was not present at that point of time, so how can I comment? Right now, what I can do? That is the way RuPaul we can get out from it. So don't criticize the colleague to please the patient and relatives. Sometimes patients and relatives are very smart. They want you to commit the mistakes of others, and once you say, they record or they somehow they quote you. So respect the referring doctor. The referring doctor, a person who has referred the case to you, should be respected and should be involved in all decision making. This will be important when you will be practicing. Referring doctor knows more than you as regards the family, their culture, their economics, their values, etc. You know only the patient's clinical data, but this fellow knows each in and out. So take him always into confidence, communicate effectively, and take his or her help if required. Keep a safe distance with the patient. Safe distance has to be kept while understanding that medicine is only a science, not only science but also an art. So emotional attachment with patient or caregiver can affect your unbiased clinical acumen. So don't give false hopes. So don't come very close to the patient and relatives. Don't try to make emotional bondage because that will be counterproductive. And sometimes over kindness is counterproductive. So when you go out of way to help, no, you should be professional in handling situations. So that also comes through experience and observing seniors. Don't give false hope. If the patient is very sick and say, don't worry, I'm there, so you'll be in soup. Tell the exact situation to the relatives, call them in a cabin and record the whole thing and say that this is how your situation is. Your patient has a large hemorrhage with large dilated pupil. We can do operation and the chances of survival are only 10%, etc., etc. So remember this punchline: medicine is a science of uncertainty and an art of probabilities. That is what the best you can describe medicine. Warm sympathy and understanding may outweigh the surgeon's knife or the chemist's drug because it's an art of probability and science of uncertainty. Remember that. Always respect the privacy of patients. Matters of life and death, terminal care, brain death, and withdrawing life support to be treated with utmost care and also science. Now, when you go to the wards and when you are seeing such kind of patient, how best you can counsel them, try yourself and look at the senior wise guys, how they do it. Because this situation you will face many times in your life. If given opportunity to save life, thank God. But if within the my power, life has to be taken, patient cannot be saved, then this awesome responsibility must be faced with great humbleness and awareness of one's frailty, because this is a humility. Above all, I must not play God. Many times patients will come and flatter you, sir, you are like God, next to God, this, that. Don't fall into that trap. Ladies and gentlemen, you are not God. What is the law of God? Doctor is God? No. Patient is the God. You say, you are my God. My knowledge is my God. I am not God. I don't play God anymore. Be professional, keep a safe distance. You know what? A time was there when the medical profession was a noble profession. Then it was reduced to a mere profession without nobility attached to it. Then it became a business. Then it became a commerce, and now it's taken shape of an industry, healthcare industry, offering jobs to doctors. Now doctors, great doctors, are now serving in the corporate hospital. That is the scenario. And you look at the patients, reaction. So we are in a very difficult time. So be very careful. Keep written records. Records are primarily intended to support patient care, but also authentically represent your consultation, including telephonic consultation. This is your lifeline. Write legibly, include the date and time, avoid abbreviation, do not alter an entry avoid unnecessary comments and check dictation reports. So this is very important. Medical legal cases are increasing, if I reiterate, and therefore documentation is very important. Be tech savvy and learn telemedicine. Communication, documentation, communication of what you have documented and documentation of what you have communicated. These are four major skills that will be required for all you guys in coming days. We all are doing right now. Now, above all, now we are touching another different aspects. Take care of your personal health and respect your family. You are a doctor, and it doesn't mean that 24/7 you have to serve. As I mentioned, time management is important, and you have made a good team. So every day, 24/7, you are not on call. That kind of system you have to understand from right now. So look at your lifestyle, diet, exercise, manage your time, take care of your personal health, hygiene, balance family life, maintain good moral character, appropriate investment. Financial health is equally important. From this time always also, the day when you start having stipends, start doing savings and invest in a proper way with the help of some financial investment. Because health is not only physical health, mental health, emotional health, there is a financial health component also. Take care of the legal, revenue, political, and media implication also. This is also now a requirement of time. So attitudes have shifted. Now self-care is now considered a core competency. In Hippocratic time, this was not so. Now in the newer testament for the doctors, the quotes now includes that self-care and health is also important. Physicians are expected to demonstrate a commitment to personal health and sustainable practice. People like me are riding on 7 horses: clinical practice, teaching, administration. I'm director of Dikna, Palana, HOD, academics, lectures, writing articles, taking this kind of webinars, then do a lot of research and write up and do medical positions as well. So our health is getting eroded. And at the same time, handling media, political persons, IAS, IPS, IRS, and difficult questions. So, friends, what I want to warn you that in the rat race of success, don't fall behind in taking care of your personal health and your happiness. Life is much more important than money. Life is experiences, wisdom, human relationships, physical health, mental health, personal passions, communications, thankfulness, spirituality. And a time comes when you, at the end of age of 50, 60, you would like to give back to the society by teaching, sharing, sponsoring, donating, and serving. Friends, life is larger than medicine. Live life king size. A stage comes when you have to understand that there is one road at the crossroad takes you to more money, more fame, more awards and achievements. That is a road of success. But the another road takes you to bliss, peace, and happiness, and that is what I'm going to talk in next 20 minutes. That is pursuit of happiness. Uh, Devanshi, I have time for 20 minutes, right?
Yes, sir.
Okay. So I have a question to ask. Do you want to be happy? Then raise your hands. Yes. You want to be happy? Good. Then be. If you want to be happy, then be. Why you are asking me? It is you who will decide you want to become happy or not. Remember, you are in charge of her happiness and not anybody else. Your friend or your circumstances cannot make you happy or unhappy unless you decide to be so. Happiness is our conscious decision, our conscious choice that is free of cost. My dear medical friends, I want to tell you, success is what you derive from the system through your skill and smartness. Happiness is what you give to the system by your achievements and your culture and your temperament. And doctors live on an average 10 years lesser than others. If an average Indian lives 74 years of life, and a doctor lives average 64 years. In pandemic, 16% was the death rate of the doctors, as against 3 to 6% initially of the in patients. Now it has fallen to 1.6. Still, doctors' death rate is 10%. Doctors are most vulnerable from the perspective of lifespan. Our quality of life, how is our quality of life? Why I'm telling you, my dear guys, you are going to carve your future. Listen to what I'm saying. This will make you happy from now. If you decide to be happy from this moment, you can become. I'll give you some roadmaps, and that is why I'm telling you it's your conscious decision, conscious choice, and take charge of your happiness. It is free of cost. Happiness is a journey, not a destination. If you mentally have a block that unless I become MD or DM, I won't be happy. Once I become DM, I'll be happy. That means you will be unhappy till you become DM. No, you are happy now until you become DM, and even further. That kind of mindset. The whole journey should be of a journey of happiness. The purpose of life. What is the purpose of life? Is to live happily and peacefully and enjoy life and give happiness and peace to others. So I'll be talking briefly. Of course, I'll be running through slides, but I'm sure you will understand the gist of it. Aristotle said happiness is the meaning and purpose of life, the whole aim and the end of human existence. In the mad rush of success or even excellence for that purpose, we are forgetting that we are happy beings. We have to be happy and make our family happy and people happy. And unfortunately, we forget this, that the meaning of life is happiness. And there are certain basic things which you should know. There are three types of happiness. So one is a pleasure, which is sensual based, derived from five senses. Another is joy. This is the happiness of achievement and success and awards. And third is the bliss, which is the internal happiness, happiness of spirituality. Pleasure comes from the outer world, where the people are only concerned with the outer world. This is sensual, five senses and instinct-based happiness, physiological, like food, sex, places, music, fragrance, etc. When we do fMRI of this patient, those respective cortex, like if I'm seeing something and becoming happy, my visual cortex is getting increased metabolism, so it becomes active. Similarly, auditory area. And the pathways are dopamine and serotonin. I'm sure you have learned in Guyton in the first and second MBBS regarding the circuits of. So second level is joy. When you begin to feel happy for no particular reason, where the happiness comes from inner world and outer world. It is more psychological. There are desires, but the desires are not only eating or drinking or going and meeting places. No. Here we have service to mankind, success, creativity, achievement, excellence in medical practice, social interaction, recognition, etc. So award, recognition, success, money, and excellence, this comes into joy. These are the ways how we can have joy. And when we do fMRI, the different set of areas in the brain are active, and this is what in the parietal periselene area. And the chemicals of joy, apart from dopamine and serotonin, are oxytocin, vasopressin, and prolactin. The third level is Nijanan, which is the highest state. Here the mind and all activities cease, or they are under our own control. Our consciousness becomes identified with the universal consciousness. And if we do fMRI during this meditation or similar activities, there is a pinpoint area in the higher left parietal posterior lobule where you get increased activity. And the chemicals here are different. They are no more dopamine, serotonin, oxytocin, or vasopressin. They are endorphin and GABA, etc., etc. We can actually quantify happiness with the help of MEG, magnetoencephalogram, fMRI, SPECT, that is single photon emission, computerized tomography, or PET. My point here, I want to give the tips how you can become happy. Physicians, heal thyself. As I mentioned, you have to choose not only this road of success, you have to also start walking on this road simultaneously, balanced life. Why we are not happy? Because we have, I mentioned about those 7 horses, and then we have children issues, social problems, family issue, competition, negative emotions like ego, jealousy. Everybody wants money and fame overnight, time management, and traffic, mobile, social media, staff management, misunderstanding, legal issue, paperwork. They are demanding patients, caregiver stress, government issue, IT, GST, demonetization, and the for front warts and other issues. So there are lots of reasons why as a doctor we are unhappy, and we have to manage our physical and mental health. And at the top of it, there's a social media kills our lot of time, 2 hours, 3 hours, 4 hours, just we chat uselessly without any productive thing. So we have to cut down on that. So what determines our happiness? Before we derive at the keys, let us find out what determines our happiness. Genetics, 20%, circumstances 10%, money 20%, attitude 50%. So our attitude, behavior, and morality decides our happiness by 50%. Circumstances only 10%, and money and health 20%. Some people are born happy because of genetical thing. These are the genes of happiness that we have discovered, and you can actually do epigenetic modification of your genes with the help of mindfulness, meditation, or your good positive actions, positive thoughts, emotions, behavior. You can actually change the expression of genes, and that is called genetic hypothesis, where you can unlock the DNA code or gene expression, and that is epigenetics. So money is important. I don't deny money can bring success, but this graph shows that this is increasing money per capita income, but it does not. This is the real income per head, which when increases doesn't reflect in increase in happiness. Beyond a certain level, money graph shows that there is a decrease in the happiness. Why so? Money can bring security as well as comfort and pleasure. It can bring improved standard of living and education, but more money corrupts and success corrupts. They may take away morality, relationships, health, bliss, and peace. So you should have optimum money for education, your standard of living, and good comfort. But excess of money will take away your health. You will die early. Take it from me. So be very careful. What is important in your life? Somebody's awards or somebody's money, how does it matter to you? Your applause and your clapping dies away, trophies gather rust, and winners are soon forgotten. How many of you will remember who are the Nobel Prize winner of last year? Nobody. But you remember the ones, your friends who have taken care of you, have helped in. So for us, what is important? How you take care of others and how others take care of you. So happiness is a state of mind. It's not something that happens that money or power can come out. So how to enjoy journey of life, keys to happiness. We'll see in quickly last 10-15 minutes. Physical, social, moral, mental, religious, spiritual. What you should do, you should divide your day. Theoretically, if you feel that you have 24 hours of day, which we have, 8 hours for your work you allow, 7 hours for your sleep, and rest 9 hours you can divide into 3 parts. 3 hours H, 3H, 1 hour for health. So do gym, do exercise, walking, swimming, whatever suits you. 1 hour for a day-to-day activity, hygiene, etc. Daily activities. And 1 hour is for your hobby or whatever your passion you should fulfill. 3 hours for your F, 1 hour for family, friends, and faith, whatever faith or religion, if you wish, you want to believe, then you can impart to that, or you can transfer to here or that. 3 hours for your S, 1 hour for service to nation, humanity, mankind, or people. 1 hour for your spirituality, and 1 hour for laughing, smiling, reading, writing, whatever you want to do. So let's see quickly health level. H. Eat right, do exercise, get enough sleep. Your executive function should be good. Learn to relax, laugh exhaustingly, and love abundantly. Enough sleep, walking, yoga, massage. Massage is our Indian massage, not the Thai massage. Laugh frequently and smile. Smile is the only way to tell if someone is happy, but this should be real smile. Smile solves many problems. And laugh frequently at yourself, not others. Okay? And if you don't remember, don't say anything. Silence avoids so many problems, with all due regards to this gentleman. Love abundantly. Friends, we have very limited time to live. If you spend your life in judging people, then when will you love them? So love them abundantly. If some of us are sick, or if you see somebody suffering from anxiety, depression, or psychosis, take them to psychiatrists, do counseling, get the drugs. You know what? If you are happy, you automatically become successful. But if you are successful, it is not necessary that you will become happy. Also, if you are happy, your psychosomatic disease will be reduced from arthritis, allergies, asthma, hypertension, coronary, to irritable bowel, acidity, constipation, tension, headache, migraine, premenstrual pain, discomfort, menopause, pain of the back, hip, depression, anxiety, substance abuse, knee disorder, skin disorder, fatigue, chronic syndrome, obesity, sleep problems, is all are psychosomatic more or less, and happiness improves them. So do 5 pleasant activities like music, dance, art, creativity, traveling. In that age, 1 hour was for hobbies. So this is for your hobbies: reading, gardening, grooming. Music is the medicine of mind. I tell you, I have learned music, classical and then guitar, Hawaii guitar, and music has helped me in relieving my stress for last 25, 30 years. Is also meditation. And ever since I learned meditation, it has helped me relieve my stress and it has made me composed and calm. Also, I do a lot of reading and writing that also expresses myself, and that is also very helpful. So I'm just giving you tip. Take up some kind of this thing. Read. A library is a hospital for the mind. So read. And I mentioned about time management. Improve this moment. Learn to remain in this moment. A good coping tool is to remember to improve this moment. Don't stay in future or past. Come out of that and enjoy this particular moment. Okay. Then come to 5 important relationships: married life, children, in laws and parents, friends, and profession. These relations are very important, which you have to balance. Married life, many of them are not married but would be on the path to select your partner, and I'm happy that I'm seeing that the trend is that students are getting hooked in the last year of MBBS, and that's a good way because then you get to know each other. And marriage is a way through which two people join together to solve the problems they never had before. So this is a very interesting metaphor of marriage. You never had problems, but ever since you got married, you started creating problems and then solving. So happy married life is a kind of oxymoron. Those two things may not go together. But people like me who are lucky have good spouses, and then you are happy and your life becomes very heaven. Women want to be understood, loved, cared for, validated, accepted, and they want freedom. Google will not answer the question. I am answering your question. What do women want? And in turn, men wants what? Leave me alone. Men do not want anything. Just leave me alone. And have friends. Friends. A person doesn't need so many friends. 1, 2 good friends are enough. Then 5 virtues. Quickly we'll see: gratitude, appreciation, forgiveness, compassion, excellence. These 5 virtues we have to really develop very carefully. You need an effort sometimes. Gratitude is what? Just appreciate people, those who have done favor to you, big or small, little or small. You just feel like, I want to thank heartily Vedanshi and the whole team for giving me this opportunity to interact with you all guys. I'm thankful to all of you to be here. I want to thank Dean. I want to thank the whole management for giving me this platform, and my colleagues who are all giving talks today. So this is my thanks from my within, and I mean it. Be grateful and appreciation and gratefulness. And appreciation is the smallest virtue of every person. You must appreciate. You may appreciate somebody's smile. You may appreciate somebody's shirt, even if not anything else. Somebody's handwriting, somebody's way of talking, somebody's politeness. Appreciate from the heart and start doing it abundantly from today and see what happens. Lot of grace will come from above. Then 5 mental processes you'll be careful. You should not be attached very much to anybody, not even a person, not to institutes, not to, because attachment is a very notorious thing. You should love them but without expectation. And you'll watch your thoughts, guard your desires and ambitions. Every thought you have is depicted now in the SPECT machine. In 1995 was I learned that if I have a anger, if I have a jealousy, or if I have a compassion, if I have a kind of positive emotion, whatever emotion or thought you can pick up in your brain with the SPECT machine, the particular area would get increased cerebral blood flow and you can find it. So it is atomic. Every thought is now atomic. So be careful, and each thought imparts lot of weightage to your body. Every cell of the body is affected with every thought and emotion. Like if you are angry, what happens? Your pulse rises, your blood pressure rises, your pupils get dilated, sympathetic response comes, and all those things. So this is how, sympathetic response, people get constricted and you are on a flight or fight run mode. So this is how each thought and emotion affects. Ambitions. Now, where ambitions is one of the major reasons of your failure. You require desires, you require ambitions, but not out of proportion. It should be in touch with reality. Amount of balance in the bank at the time of your death is the extra work that you have done, which you should not have done. So don't do extra work. Stop comparing yourself with others. His or her life chart is different, yours is different. Why you want to compare? You are best in your own. Do compare with your own self. Stop expecting from people, stop criticizing, start sharing, start helping, start loving. Give, forgive, and count blessings. Enjoy moment every day and follow the ethics. And with that, this is the last part of the talk. In 5 minutes, I'll finish spiritual practice. Friends, I mentioned about 3 S: service, soul. And here, spirituality is not something that, a belief or a religion or Hindu, Mohammedan or Sikh or Isai. Spirituality is sitting with your own self. If you are alone, sitting with your own self, that is spirituality. Look into what is going through your heart or mind. What are your thoughts? Try to decipher them, try to change if they are negative. That is spirituality. Sitting with your own self in simple word is spirituality. And the moment you start seeing yourself and talking with yourself, you will realize why you are unhappy. Because of your own thoughts, your wrong emotions, your desire, your ego, your attachment, your attitude. These are the reasons of our unhappiness. And spirituality, friends, is able to remove all those negative things. So do some spiritual reading, do satsang, chanting, prayer, meditation, and whatever books you like, little Bhagavad Gita or whatever book you like, just read that and at least spend some time with like-minded people. If you're nothing, I don't want you to go to daily temple or this or that. No, that is a religion. I'm talking about spirituality. Pray for people. Pray for well-being of all humankind and even animal kingdom. Pray that this corona goes away. Pray that economy sets back into the original tune, and pray that everybody remains healthy, happy, everybody lives long. That is this prayer. And meditation is also a very important thing. And unfortunately, I'm not talking on meditation today because it's altogether a different topic of 1 hour. But the neurochemistry and neurophysiology of meditation is just, you should understand, guys, this is the reverse of stress. Stress is sympathetic overload. Meditation is parasympathetic overload. So meditation mode is yogic mode. Slow pulse, slow BP, slow respiration, calmness, kindness. And you can learn meditation from your guru or guide or from online platform. Focus on breathing like Anapanasati, or focus on object like Patanjali Rajo, focus on a sound, focus on a thought, focus on a sensual object, focus on sensory perception like Vipassana, imagery, soul meditation. What I want to draw attention to, one of the important landmark research on meditation. I was doing research on fasting on human subject, and in that context, I had to go to USA sometimes, and I had a fortune of meeting some people in NASA, and then later to Professor Andrew Newberg, who was doing some research on meditation. Now, this fellow first time in 2002 brought out a seminal paper, SPECT Images of Meditation. That is, a SPECT is single photon emission computerized tomography, which shows, depicts the blood flow of the brain. And he's demonstrated that before the meditation, the baseline, this is the status of blood flow in the prefrontal area of human brain. But during meditation, after 30 to 45 minutes deep meditation, you can see there is increase in the red mark. Red mark is the blood flow. Roughly 30% increase blood flow in prefrontal area. What does it mean? It means your what resides in prefrontal area. You must have read in your anatomy books and physiology, etc. Here resides your intelligence, judgment, prioritization, executive function, planning. What you plan like conference is your executive function. Your higher senses, everything. Why human race is important and ruling other species. Why is ruling the planet? Because of our prefrontal lobe, which the other animals don't have. And here, all these gets increase circulation, so you become more powerful, intelligent, so-called pragnavan, and your intellectual and intuition both improves. The second important seminal manifestation he found was in the posterior parietal lobe on the left side. This is a parietal area. Here, there is sudden drop of blood flow during deep meditation. What does it mean? This is the area of orientation to time, place, and person. And here, during depth of meditation, you are no more manifesting. Therefore, your ego, your attitude, your thoughts, your emotions, your desires, all they subside with meditation. And during long-term practice of meditation, you become a better person. You can control the processes of your mind, which we discussed, same attachment, ego, your attachment, rag, dvesh, your desires and thoughts. So you become master of your mind. You can control your mind, or so to say, man mein se aman hone ki prakriya. So that is what meditation is. So this is the fMRI of the meditation scan. So friends, here I want to end my talk. This is the formula of happiness for you, which took 60 years of my life to arrive at, which I am giving you in just 1 hour. Stop comparing, stop expecting, stop criticizing. You can take a photograph, start sharing, start helping, and start loving people. Don't criticize, just love them. We have a very short lifespan. We don't have time to love. How do we criticize? No time. Give whatever you can give to people, your time, money, or whatever. Forgive people for whatever small weakness. Don't keep in grudge in mind. It occupies space in your brain and takes rent. Don't do that. Forgive and forget. Count blessings, enjoy every moment. Learn music, dance, art, creativity, read great books, do sports, do gardening. Take all the chance to appreciate people, thank them heartfully, learn creativity, be with nature whenever you have time, go to sunset or sunrise, or spend time at the river bank, enjoy traveling after Corona, of course. Accept your own limitation, don't compare. Do yoga, do exercise, control your mental processes, as I said, attachment, control, ego, anger, greed, and jealousy, and do prayers, whatever 5-10 minutes you can do chanting and do meditation. Whatever you can do, not always possible, I understand, but whatever little you will do from this roadmap, I am sure it will add to your happiness. So on the left brain, you have success and excellence. In the right brain, right hemisphere, connecting hemisphere, your happiness. In fact, happiness lies all over both hemispheres. And I have given you keys of success and excellence on one side, and I also given you keys and roadmap of happiness on the other side. My dear lovely friends, I want to tell you again that I love my students. I want you to be happy and successful both. So take a whatever you can take from this, you do that, and start appreciating people and nature, and start loving people, and also thank God and thank everybody around you, and try to control your mental processes. Do meditation and prayer. I think I have gone a very long way, and this was the chart that I had given, and this is the address of happiness. Happiness lies inside, happiness is not outside. Don't rush in the external world for happiness. The true happiness is inside, and don't think that your happiness depends on persons or people, or your unhappiness is due to one person or some circumstances. It is you who are the creator of your happiness and success. Okay, so do that, enjoy. Decide every morning that you are in a good mood. Happiness is a choice. Thank you very much. Thank you very much. I hope you enjoyed.
Thank you so much, Dr. Sudhir sir. If anyone has any questions, please feel free to write it in the chat box. So there's a question. While we are on the topic of success, the topic of failure is bound to come in our heads. So during our journey to achieve our dreams, failure is something everyone fears of. So how to not let that get in our head and not affect our hard work and determination?
Well, I think without failure, nobody meets success. So you have to understand that if you are meeting a failure, that means you are proceeding further on the path of success. And look at the lives of people like us. Like we also met failures in life, and if you consider we a little successful people, if not fully, then we had also faced failures in life, failures at so many fronts. But like my success should not go to my head, my failure also should not go to my head. The every time I lose or fail, I try to analyze where I went wrong, why the things went wrong, and I just work upon that. If I want to achieve that thing again, then I do another attempt and come out with brighter things. So this very simple mindset, you don't take things to, I have seen many people, equating themselves with success and failure. No, you are not representing success or failure. Success and failure is a circumstance, and circumstances do pass away, they are time bound. So neither success nor failure should go to your head, not to your heart. I tell you, failures sometimes teach such a big lesson, and they bring down you to the ground also, which is also necessary. If all the time you are flying, then you will become arrogant and nasty man. So basically, failure comes to teach you a great lesson, and every time you fail, you should understand that your path further is more clear, and now you can see with clarity. So should not be disturbed at all. Okay.
Yes, thank you, sir. So next question is success and happiness. There is the balance is very important in life. So do you think believing in certain religions or having spirituality helps in striking that balance, having faith in God?
Yeah, I mean, as far as I am concerned, I do believe in God. I do believe in human beings, and I do believe in all living beings. So I really, whenever I want to lay my head somewhere, many times my attempts have not succeeded or have failed. Or many times when I have succeeded, where do I go and put my head? That is that particular factor we call God. You may not believe in God or religion, you may be atheist, but then also there is some element where you want to put your head, and you may coin whatever name it is. That is very important. Faith and belief system is the system that is very operational in human body. And all of you I want you to read the Biology of Belief, the book by Bruce Willis. You must read all that. I don't have time to explain how the faith, not the faith in a religion or God, faith itself is very important word. How each of the cell has a 7 microvolt current and total 70 billion cells. How do they create energy, and this energy, how does it help? So I think that is the science of faith. But let us come back to the ground level. You know, faith in a religion and faith in God is one aspect. But what are the religions for? Do you know what is religion? Religion is nothing but the laws of nature to preserve nature and preserve biology. What does a religion teach? All religions teach the same thing: uh, truth, non-violence, non-stealing, don't collect more than what is required, that is aparigraha, and be faithful to your spouse. These five things: satya, ahimsa, brahmacharya, aparigrahaste. Now, if you imagine a society where everybody is allowed to do everything, everybody can say untruth and do stealing and do, become debaucherous and all, what will be the system? The whole nature and the whole biology will fail. So in accordance with the survival, compatibility, and coexistence, the laws of religion are made. And whenever we have violated these laws, like we did recently, Corona has come up. So nature teaches great lessons whenever we violate, when we disturb so many species, then these kind of things. Why even Corona? There'll be Dorona, there'll be Gorona, there'll be earthquakes, there'll be tsunamis. So religion is nothing but maintaining ecology and balance. If you really understand the religion, that is what it is. And for that, there is a name called God. Whether you believe it or not, there is something which is why we are here. What is the reason of existence? We have to understand that. Even Einstein, people like Einstein also at some point of time had to confess that yes, beyond that there is God and nothing else. Okay, so even if you reduce science to a mere physiological and physics, then also there is one point where you don't know beyond black hole. That is one thing. Now coming to spirituality. In spirituality, you don't require the belief system of God, because spirituality is beyond religion. What is spirituality? As I mentioned, if you are going from stratosphere to ionosphere, you require a rocket to propel you. Then from ionosphere, when you go outside troposphere, you require another rocket to propel you. And when you are out of troposphere, you are in the space. So space is what we call is spirituality. But before that, the religious system comes, yoga comes, and then these two rockets bring you to the space. By yoga, I mean karma yoga, gnan yoga, bhakti yoga, and raj yoga. So these are the engines beyond religion. These engines are required, and then you come to the spirituality. Spirituality is meditation, kind of self discipline, some kind of penance, or some kind of what we call as tap, and high spiritual reading. These are the spiritual things, and that really brings you to the realm of inner domain, where the consciousness, some people call it soul, scientists, neuroscience calls it consciousness. So that is where the spirituality stays. But no one can directly go to space, so one has to pass through certain stages. So religion has 4 steps: dan, tap, Sheel and Bhav. Dan is donate, charity, do whatever, Annadan, Vastadan, Gnan Dan, or Paisa Dan, whatever. Top is your some kind of austerity or penance. Sheel is your character, Ahimsa Satya, Ahimsa Satya Aste Brahmacharya Parigam. Top Bhav is your inner core feelings and emotions and your own compassion. So this is the structure of religion. Beyond that, everything is in space where you are with your own self. Then you are qualified to talk to yourself, look inside yourself, and find out where your miseries are, why your wrong thoughts, wrong beliefs, wrong ego, wrong attitude, attachment. This you can literally find out and work upon that, and that is the spirituality. I hope in the short time I have tried to clarify, but this is exactly what it is.
Thank you so much, sir, for explaining that. With this, we'll be ending Dr. Sudhir sir's session, and I'll request Dr. Heer Shah to take over for next speaker session. Thank you so much, sir.
Thank you. I hope everybody enjoyed. Did you?
Yes, sir.
Thank you.
Yes, sir.
It was slightly high-powered talk, but I thought it was necessary for all of you.
Thank you so much, sir.
Thank you.
Thank you, Vedanshi. So our next speaker is an orthopedic surgeon who is a blend of academic excellence and entrepreneurship with the interest in all the aspects of bones and joints. He is one of the most academically inclined and innovation-oriented surgeons. He is coveted member of several bodies of orthopedic association and is dedicated to developing career in learning and teaching the advanced techniques of orthopedic surgery. He has been credited with more than 1,000 plus trauma surgery, total hip and knee arthroplasty, arthroscopy, and spinal trauma surgeries. Please welcome the doctor who has enriched the orthopedics in the hearts of all the PG aspirants through his instantly recognizable catchphrase, OPD, next patient, please, Dr. Tushar Mehta.
Hi. Good afternoon, everyone. Hello.
Hello, sir.
Yeah, am I audible to all of you?
Yes, sir, yes.
Chaliye, that's good. So first of all, thank you so much for having me here, and it's really a matter of honor and pride to be a part of this conference, which is conducted by the young inquisitive enthusiast of the medical fraternity. And I would certainly first appreciate the speaker prior to me, Dr. Shah. Actually, what he spoke about was something which is certainly very much required in today's time. As far as I'm concerned, I'm an orthopedic surgeon, and I come from a small town in Haryana. And then, right now I'm taking care of my clinical as well as academic career. So I'm an orthopedics faculty with Delhi Academy of Medical Sciences, DAMS. And apart from that, I have created my own portals for education and for clinical approach as well. Is there some I think some network issue? Am I audible?
Yes, sir, you are now.
Yes, sir.
Okay. So I think some network issue from my end, I think. Am I audible to you guys?
Yes, sir.
Yes, sir.
चलिए मुझे खुद को वो feedback नहीं आ रहा था. Okay, so basically this conversation that we are going to have today, that is about, as you must have seen in the post also, so it is about the journey that is from clinical to academic. I'll first take you in the beginning. So basically, I come from, as I said earlier, I come from a small town in Haryana. The place is called Bhiwani. I come from a family of doctors. When I was in school, I mean, the only identity I had that, I am son of so-and-so doctor. So I was little, I mean, of course, I was academically good, but at that point of time, the identification that I had was from my father. And it happens. I mean, most of the boys who are listening to this will correlate to this, that, as you grow up, you kind of have a identity, crisis, and you want to be identified with your own identity. So I always wanted that, I should be known by my name. So that was some kind of a zeal that I had. And I always wanted that apart from my father's name, which is certainly, a blessing for me, but I should have my own identity. But the biggest problem was that how to go about it, how to approach it. Wanted to become a doctor, there was no doubt and there was no confusion in that, but the only thing was that how do I cross the barrier of course internet was not there, we never had any Zoom, Facebook or anything. So how to get myself tuned to the metro city, like Delhi was closest to us. So that was certainly a very big problem for a person like me. So all said and done, I crossed my 10th, and then I crossed my 12th, and got selected into the PMT. So when I was in my medical college, then you enter into a medical college, since I can presume most of us who are listening right now are MBBS students and maybe interns and post interns. When you enter a medical college, even in those days and even today,
you feel a kind of little relieved. Like first year, when I entered into the medical college, I was very much relieved. I thought that, my job is done. Ho gaya, that's all. I mean, I'm sorted. I don't think there is anything else which is required now. So keeping that in my head in my first year, I became very relaxed. Of course, I was very good academically, but I was a bit relaxed. Like I was focusing on anatomy, but I was not focusing on other things. And I thought that, the half of the thing is done and I've achieved the game and now I will definitely become a doctor. In those times, the competition for PG entrance was there, but we were not oriented about it. I mean, the problem was the lack of orientation, I'll be very honest. लोगों को पता ही नहीं था एग्जाम था टफनेस था सब कुछ था everything was there but people were not oriented about it. So when I came to my second year, somehow I could clear my first year. When I came to my second year, then it was that moment I realized that no, it is something which is going to be a little tougher than this. So I started with the second year, did well, I was focused, I was doing good. Third year again, final year again. But by the end of the final year, I could analyze that yes, I was doing good in my, in my university exams. But somewhere down the line, I don't think I'm trained for the entrance purpose, or because you have to understand that there is a difference between PMT and PG entrance. Because in PMT, you are hardly having 3 subjects. You have pressure, but you are naive, you are young, you are full of enthusiasm, you have a dream, you just, even in your nights, you see a white coat and a stethoscope. So somewhere down the line, you are more enthusiastic than ever. But when you come to a PG entrance time, you're already 22, 23, you are 24 even, 25 even. So at that point of time, you have zeal, but you have a lot of distractions. And plus 3 subjects in PMT to almost around 19 subjects in PG entrance. So at certain times, you fail to understand, the MCQ is in front of you, it is coming from which subject. But one thing was pretty clear in my head that, I wanted to pursue orthopedics. So that was my very clear view about that. Now, when it came for the time for the PG entrance, then I thought that, I should, maybe I should switch over to a bigger city for a better education. So I went to Delhi. I started, I started studying over there. I started, in the later half of the internship, I got a time and opportunity. So when I came to Delhi, it was at that point of time I realized that I was probably, 100, 200 kilometers away from civilization. Internet is something which I can say today, it's a very big blessing, guys. You have to admit this is the biggest blessing that one can have, because we never had in those days. Hamare time pe aisa kuch bhi nahi hota tha. We never had the exposure to even talk to people. We never knew what is going on in Ahmedabad or what is going on in Delhi or what is going on in Kottayam. We never knew anything. So when I came to Delhi, I realized that probably I was good in my medical college, but that is nothing. So when I came and when I saw all other students who are dropping and who are taking so much amount of pain and stress to, study for their dream, at that point of time, I realized that yes, it takes a lot more than what I have. So I started giving it more time, and then I felt that, maybe the hard work alone is not sufficient. It should be combined with the smart work. यहाँ पे एक point है which I want to emphasize to everyone, that whenever you have a vision, whenever you have a mission, there are only 2 things which are important. Number one, you should have a clarity in your head that why you started your journey. That why is very important. You have to think of the broader, the broader image of your goal. हम सोचते हैं कि we have a vision कि हमें ये goal achieve करना, और हम वो शुरू हो जाते हैं. No, but at every single point of time, you have to realize your head that why you started your journey actually. That why should be instilled into your head at every single moment. And the second thing is that whenever you're proceeding your journey, you have to understand that it is not always the hard work that wins. It is a blend of hard work as well as smart work. You should know when to get in a subject and when to get out of that subject. So probably I could realize in those days that yes, I have to make a balance between the subjects. And the only word which I realized after coming to Delhi is the most important for any medical student is the word called coherence. The most important word in PG preparation is keeping sync and coherence. Because if you're not coherent with your anatomy and your radiology, then you are going to lose the battle. You have to sound coherent. You have to study coherently, because if you focus only on anatomy and you ignore radiology as a short subject, then you are not going to crack the exam. I'm sorry. So in Delhi, back there in those days, I realized that coherence is the only word which I have to learn here. Of course, that worked for me. My dream was orthopedics. I ventured into orthopedics. When I came into the world of orthopedics, it was altogether a new word. Now, I have spoken about, a bit about the people who are into the phase of MBBS. Okay? You have to understand that while you are doing MBBS, I don't know about you all, but when I was in my first year, I'll repeat that again, I had a vision in my head कि हो गया. My dream is over. It's all sorted. मेरे को जो चाहिए था मुझे मिल गया. I've become a doctor, white coat, stethoscope, nothing else is required. And probably it happens, at times when you are in a medical college, you feel that, you are running the place and you are, taking care of the things. So there's a dialogue in Rang De Basanti, so ki gate ke is taraf hum duniya ko nachate. I want to tell you ki gate ke us taraf duniya to nachayegi. So in a medical college, at times you have this, tendency that goes into your head that, people are there for you. But when you step out of that place, you fight with lakhs of people for selected PG seats, you get to know that life is, far more difficult than this. And then I'll tell you, when you sort that out, when you enter into a branch like I did, then again there is a heartbreak. अब मेरी बात को समझिएगा, दिल फिर टूटता है, मेरा बहुत टूटा, because when I ventured into orthopedics for the first 1 month, I was amazed. I was amazed by the kind of ignorance that I got from the department. Surgical branches are like that. If agar koi PG kar raha hai, use malum hoga. So in a surgical branch, it is a very difficult job to make sure that you are in sync with your seniors. We were standing 12 hours in a day. We were holding, the limbs of the patients while the surgeries were being done. The traction kit is not working. We were supposed to apply traction. For a minute, I thought that I would just step on a red carpet and there will be, people around me giving me knife and scissors and osteotomes and scissors and drills, and life will be a cakewalk. Life is not a cakewalk. Life is not a cakewalk in PG entrance. And believe me, when you enter into post-graduation, the only extra thing that you have in your life is another 10% respect from your family and friends. सिर्फ 10% इज्जत और मिलती है परिवार में और कुछ नहीं मिलता. So वहां पे आने के बाद I realized कि bloody hell, when I came into the medical college, I thought my dream was over. It was not. When I ventured into orthopedics, I thought my dream was over. It was not. And that was a kind of heartbreak that I had. And of course, I'm sure many of us will understand that heartbreak वैसे भी चलते रहते हैं medical college में. So there was another heartbreak which was going on, and there was a professional heartbreak that I had. मेरे दो heartbreak इकट्ठे चल रहे थे. So I was like कि ये हो क्या रहा है, ये चल क्या रहा है? How am I going to manage this? It is so difficult. I used to cry. I'm telling this on a national platform. I used to cry. It is okay to cry, and it is okay for the boys to cry. Don't take it on your heart कि नहीं ऐसे नहीं होता वैसे नहीं होता, लड़के रोते नहीं, बिल्कुल रोते. I used to cry. I still remember there was a bucket of the hostel, and there was a chapdi wala over there who used to sell tea and samosa and all. I used to sit under a tree and I used to cry. One of my seniors was very kind to me, used to come, used to console me, used to tell me everything will be fine. I said, boss, I think I've entered the wrong profession, or maybe I'm the wrong man. I don't know. He used to tell me, Tushar, nobody is wrong. It's just the timing which is wrong. And it is wrong for almost every postgraduate. It will be there. It will be wrong for maybe another 5 to 6 weeks or maybe months, and everything will be sorted. And then again, I started thinking of why I started this journey. See, I'll tell you, the only thing which will pump you every second, every minute, every day is that why. जिंदगी में जब भी हम सुबह उठते हैं, अगर एक दिन के लिए लगता है कि नहीं आज नहीं हो रहा है, monotony हो रही है, whatever, the only thing which is going to pump you is why. So again, I started thinking of my why, that why I started this journey 6 years ago. For 5.5 years of MBBS and 6 months of prep, PG prep. So I said, 6 साल पहले मैंने सफर क्यों शुरू किया था? इस दिन के लिए तो किया था, आज ये दिन मिला तो मैं रो रहा हूँ. So then I used to gather another, dose of confidence every morning, and I used to go to the hospital. Sometimes get abused, and sometimes get, sometimes they used to just heckle me like anything, and I used to come back. But somewhere down in the depth of my heart, I had a feeling that maybe one day I'll become friends with all of them. And then I realized that it is kind of a perpetuation process in the medical hierarchy of India, that a HOD is not supposed to be friends with a postgraduate student. Assistant professor is supposed to find out mistakes in you. Probably that is going to improve you. So all those people who are about to enter post-graduation or who are into post-graduation, please try to understand it's not a big thing. Don't take it on your heart. Don't take it on your head. It should not be, bonding on your nerves. Koi baat nahi. It's okay. It is the hierarchy. It is like that. There is a kind of a mutual respect which is hidden, but it will come out as you will enter into your seniority. So next year I was a senior, and when I was a senior, things were started settling down. Now again, you understand the feeling, the life of ups and downs. So now in my second year of post graduation, I had another up. What was that up? कि मेरे पास first year आ गया. The way I used to get behaved, now I can behave with another person or maybe a couple of other people. But at that point of time, I started thinking that, what next? I started thinking of academics. Maybe I was not very good I was not one of the best in academics, but I could comprehend things. Now, when I say comprehend things, of course, the speaker prior to me, he was so learned. He spoke about many things, right from meditation to spirituality. Hats off to him. But there is one thing that I want to add. I think it makes sense for for the mankind. I think पूरी जो इस दुनिया के इंसान है, हम जितने लोग इस धरती पे रहते, if we get this one trait called as abstract thinking, I'm telling you guys, we will never fail in life. आप कोई भी जिंदगी में काम करें, आप डॉक्टर हैं, आप academician हैं, you're a businessman, you're an engineer, you're a president, you are anybody, you're a prime minister. If you have abstract thinking, your life is sorted. Now, what is abstract thinking? It's a fundamental of psychiatry. It is the ability of a mind to convert concept into generalization and generalization into concept. ऐसा मैंने पढ़ा है कहीं पे that a human brain, achieves this capability of abstract thinking by 7 to 8 years of age. I can tell you, I'm a doctor. We all are doctors here, but I can tell you, we acquire it almost, after 35 years. हम डॉक्टर्स के साथ एक प्रॉब्लम है, हम एक कॉन्सेप्ट को जनरलाइजेशन और जनरलाइजेशन को कॉन्सेप्ट बनाने में 30 साल लगा देते हैं. Why? Because we are tubular. We have a tubular vision. हम एक ही दिशा में सोचते हैं, हम एक ही दिशा में काम करते हैं. And somewhere down the line, I was not finding it very good when I was in my second year. And I could feel that I have this capability of abstract thinking. So I ventured into education. I met one of the leading educators of the country, Dr. Sumer Sethi. He was heading dams. I met him, kind of a like-minded personality, and I said that I want to enter into academics. I want to teach people. I want to teach them how to solve an MCQ. I don't want to teach them the content. Of course, I will, but I don't want to be a simple rote learner. I want them to develop this abstract thinking. So probably that zeal in me wanted me to venture into academics. So I took my first lecture in dams when I was in my second year post-graduation. It was hardly the beginning of the first month of my second year PG, and I took my first lecture in dams. And it is at that point of time I realized that yes, I can venture into this field as well. The reason was not that I'm a multitasker. Many people say you're a multitasker, you have multitasking capability. No, we all can be a multitasker. We all can do anything. The only two important things are you should start from ground level work. You should never become directly the boss of the company. You should know what is happening at the ground level. You should have the experience of doing that. And the second thing is, again, abstract thinking. It is simple. So that point of time, I realized that yes, academics is again a cup of tea. I wanted to add another feather in my hat, and I was enjoying it. Now, by the end of the third year, I was busy with my thesis and all those things, and I cleared orthopedics. I was, it was a DNB that I chose over the degree just because I was getting a degree in a peripheral city. I was getting MS orthopedics in a tier 3 city, in a tier 4 city, but I chose city over degree. That is something that I did it was a kind of a bold decision in my days, but I don't want you people to do it. I don't know, maybe I would certainly say that I was lucky. I chose Delhi DNB over MS orthopedics in a tier 2 city because I have had preferences for Delhi, and somewhere I could feel that, I don't want to go away from a big city because I had done my MBBS from, a smaller town, and I could feel that when you live in a small town, you are a little away from civilization. So this is what I felt in those days, but that's not binding today because of the internet and connectivity and everything. So when I cleared my third year, I did DNB. I cleared theory in practical in first shot, and guys, believe me, it was a rare phenomenon in those days. And when I did that, I could feel that yes, again, my journey sorted, my dream is over. I think I got my why. This is what I thought कि मुझे मेरा वाई मिल गया, मेरा तो काम हो गया, मुझे जिंदगी में और कुछ नहीं चाहिए. PMT हो गया, MBBS हो गया, then PG prep में हो गया, PG हो गया, orthopedics हो गया. Life is sorted. Tushar, what else you need now? You're a sorted guy now. and there is no MCH in orthopedics. Of course, there was one in Liverpool, but that is certainly not required. You can make good money here. Now, when I cleared my orthopedics, I joined, listen to this is very important, I joined a senior residency. Now, when I joined senior residency, it was hardly second or third month of senior residency. At the same time, I was managing lectures of orthopedics in DAMS as well. So I was coming back on a flight from Aurangabad. I remember it was a Sunday, and I met someone, and that someone, just out of a random conversation in a aircraft, that person asked me, he said, so what's your name? I said, I'm Tushar. I said, what do you do? I said, I'm a doctor. What doctor? PhD doctor? I said, no. I'm a postgraduate. I've done my post-graduation. I'm an orthopedic surgeon. He said, where hospital are you working right now? I told him. He said, are you salaried? I said, of course. He said, can I tell you something? I said, of course, why not? He said, Tushar, the way you have 4 phases of life, that first you are a child, then you're a bachelor, then married, and then, all those phases. He said, similarly, in professional life, you have 4 phases. First is salaried. You are a salaried guy right now. You wake up at 9 in the morning, you wake up at 7 in the morning, you reach your place at 9 a.m. in the morning. Your only attention right now, headache right now is marking your attendance. Your job is over by 5, whether the work is finished or not. You can leave, you go back home, you have a good time, you enjoy, you catch up with your friends, you make some phone calls, tum relax karte ho, pair palate so jate ho. Only thing that is into your head is ki tumhe every month, by the 5th of the month or 7th of the month, your salary will be credited in your account. I said, of course. He said, but is that salary, are you very happy with the salary? I said, sir, who is happy with the salary? Nobody is. So even I'm not happy with the salary. Whatever amount that I get, okay, fine. He said, so this is the first phase of being salaried that you're enjoying. I said, of course. He said, the second phase is self-employed. He said, in a self-employed person, there won't be any headache of reaching a place and marking your attendance or putting your thumb on a biometric. Tum subah 8 baje utho, 7 baje utho, 9 baje utho, what time, whether you wake up, that doesn't matter. But what matters is that every day you have to dig a well, you have to take out the water and you have to drink it. You will not enjoy the perks of being a salaried guy. You will have to make your identity on a daily basis. Roz kuan khodoge, pani piyoge, the day you will not be able to do that, you will starve. Tum paise mar jaoge. Pani milega to theek hai, nahi to nahi milega. He said that is the second phase. Whatever work you will do, it will be credited on your name. Whatever amount you will get, it will be credited on your name. So positive, negative, benefit, loss, acha, bura, today, tomorrow, everything is yours. You will not be bonded with anyone. You will not be employed with anyone. And that is the next step that I want you to do, young man. I said, thank you so much, sir. He said, and after that, maybe I'll meet you or not, since we are talking in an aircraft and no mobiles are working. There is a third phase. He said, the third phase is a businessman. You have to become a businessman. I said, what does that mean? He said, the way you are salaried right now, probably in weeks or months or years, you will become self-employed. A businessman is that who hires those salaried people, and some self-employed people maybe even, who work with him so that whatever money they earn, some major part of it goes to them, but some part of it goes to you. He said, just like a hospital owner. You are an orthopedic surgeon, you run a big hospital, there are 5 other departments, you give them salary, 100 rupees if they earn, 70, 60, 40 goes to them, remaining comes to you. So whether you are working or not, maybe some money is coming to you. So he said in that, the only catch is people management. You have to manage other people who are working with you. And fortunately or unfortunately, they are doctors. They are the most prestigious people, who are the most learned people. जिन्होंने जिंदगी में सबसे ज़्यादा पढ़ाई करी है. So you have to make sure that you give them due amount of respect. And you give them their due amount of credit, which they contribute to you. He said in that, it is kind of basically, it will be a human management. It will be a HR management, human resource management. You have to manage people who are working with you. And that will give you probably an identity. Because in the life, he said this line, in the life, it doesn't matter what you do for any other person. In the life, what matters is how you make the other person feel. So if you feel them honored, if you feel them respected, they will be honest to you and everything will be fine. Now that kind of clicked me again. So I said, sir, you have said the most important thing here, that right from salaried, I can be a self-employed, I can be a businessman. So maybe, sir, I will think of this. He said, no. But there is one more thing. I said, what is that one more thing? He said, there is one more thing that I want you to become, that apart from this, you can start another venture, maybe into academics, maybe into any other thing, maybe pharmaceutical or anything. And Tushar, I can tell you that you will become the 4th phase. That will be the 4th phase of your profession. That is what is called as an entrepreneur. So way back 10 years ago, he told me the first phase of salaried, which I was, the self-employed, then businessman, then an entrepreneur. He said, you will just invest your intellect, your knowledge, your money, your time, and you will not do any hard work. The rest of the people will manage the hard work with your intellect, and whatever they earn, they take their share, 70, 80, 90%, and remaining comes to you. Guys, it was 12th of August. I was a senior resident. My 24-hour duty was on 15th of August. I did that duty 16th morning. 16th was my off. 16th morning, when I was leaving the hospital, I informed the HR that today is my 24-hour off, and day after tomorrow, I'm coming to settle the NOC and everything, and I'm not going to continue. They said, you have to serve 1 month notice. Otherwise, your salary will not be given. I said, that's okay. You can keep the salary. Not a problem at all. So I left my salary because I was not concerned about that salary. What I was concerned about is that I have a vision in my head that I'm leaving this phase of being salaried because I want to become self-employed, and because मेरे आगे बहुत कुछ था करने. उस फ्लाइट पे मुझे अगले 10 साल दिख रहे थे कि अभी तो यार फर्स्ट फेज पे है, फिर self-employed बना, फिर business, फिर entrepreneurship. So I just wanted to run and rush, and in that effort I did not even inform my family, and I took a step. Again, I don't want all these things to be there's a disclaimer in all those action movies, so not to be performed at home. So I don't want all of you to be so much amount of on an adrenaline high. But yes, I was lucky. I took bold decisions, I took major decisions, and I was lucky, and I was very lucky. I was very lucky that when I left that job, I came to another city. Like there's a twin city in Delhi called Gurgaon. I got good opportunities. I became self-employed. I was working day in and day out for me. And then I ventured into a hospital. I opened one in my hometown. I opened one here, and then things got pretty fine from there. And of course, education was going on in a parallel way. So what I'm trying to tell you is today that whatever you do, you have to understand that you have to have a larger picture in your head. You have to have a macro picture into your head, but at the same point of time, you have to focus and analyze every micro problem which is going on around you. You have to be a troubleshooter. You have to be a problem solver. You have to be a multitasker, but at the same time, you have to work coherently. आप ऐसे नहीं कर सकते कि मैं ये कर रहा हूँ फिर ये छोड़ रहा हूँ, ये कर रहा हूँ फिर ये छोड़ रहा हूँ. नहीं. A confused mind, I'll tell you, a confused mind is an ungrateful heart. Whether you like it or not, but I have a feeling in my head, any confused mind in front of me is an ungrateful heart. That means he does not believe in himself. He is not grateful to what he is today. वो confused हो रहा है, उसको doubt हो रहा है कि मैं सही जा रहा हूँ कि नहीं जा रहा हूँ. इसका मतलब उसको खुद पे confidence नहीं है. He is not grateful to himself. So please don't get confused. So this is another lesson that I taught you at the end of my senior residency. But life was not, again, a bed of roses or a cakewalk after that. I ventured into my clinical career. I was doing good academically. DAMS was, going up and high, and we were also a part of it. And we took other centers also, and everything was fine. But at the same time, my clinical career was going through ups and downs because I was self-employed. I started a hospital. At one point of time, I remember I used to give a salary of around 17 lakhs a month, 17 lakhs a month, where I was getting hardly 5 to 6 lakhs of revenue from that hospital. It went for about 4 to 5 months. But then again, that was not a problem. Why? Because the rest of the, 10, 12 lakhs, I was managing from my other earnings. I used to slog every day. I used to work hard every day just to earn certain money to give it to another person the next morning. मेरी जिंदगी में ही चलता था. पूरा दिन मेहनत करके जो पैसा कमाता था वो अगले दिन किसी को दे देता था कि ये ले भैया तेरी सैलरी ले. Why? Because hospital is not working. But 3 months down the line, again I sat down. I had a shower and I had a good tea, and I sat down and I started realizing what is the problem. The problem was that probably we are trying to find out the solution without analyzing the problem. हम सब solution ढूंढ रहे हैं, how to make it work, but we don't know what is the problem. So I found out the problem. There were many pitfalls, there were many lacunas, there were many issues that we had in our setup. There was a problem with marketing, there was a problem with many other things, and there were some legal issues going on. So at that point of time, I realized that managing a hospital or working to make sure that your dream of a hospital is coming true, just being a doctor alone is not sufficient. And it is at that point of time, I still remember in 2014, I wrote a post on LinkedIn also that Medical fraternity is nothing but an emotionally defined humans. They are the most unsuccessful business people. I personally feel today's scenario is changing. I've seen many people doing very good, but in my days, only 1%, I tell you, only 1% medical people that had a good business acumen. ये सबसे बड़ी प्रॉब्लम है हम लोगों के साथ. हमारा business acumen बहुत poor होता है. And I feel very sad and I feel very bad today. The city that I live in, Gurgaon, it is famous for its healthcare. We have Artemis, we have Medanta Medicity, we have Park, we have Paras, we have Fortis, we have Manipal, we have Columbia Asia. More than 75% of the healthcare revenue that the city or the country is earning is going to the people who are sitting outside the country. ये एक फैक्ट है. हमारे देश के जो लोग हैं जो अपनी हेल्थ केयर से एक पैसा दे रहे हैं, उसको पे कर रहे हैं, उसका 75% पैसा विदेशों में जा रहा है. सिंगापुर, हांगकांग, सिकोया, वेंचर कैपिटलिस्ट, पी फर्म्स. So my aim of talking about this towards the end of my conversation is to tell you only one thing, guys. Please develop that acumen of micro entrepreneurship in you. You might be 22, 23, 24 listening to me. एक माइक्रो एंटरप्रेन्योरशिप आप अभी से लेके आइए अपने अंदर. ये बहुत जरूरी है. You have to have the understanding that you are not going to become just a doctor sitting on a chair and seeing maybe 100 patients a day and managing one lab and one pharmacy in your clinic or in your 5-bedded, 10-bedded, 20-bedded hospital. No. Start the fundamental of group practice. Start the fundamental of 50-bedded, the most hospitable hospital. You go to any big hospital, any 500, 400, 300-bedded hospital, you will take at least 15 minutes to realize that where is the reception and where I have to get my form filled and where I have to pay the money and where I have to see the doctor. आपको 15 minutes लग जाएंगे because they are hospitals, but they are not hospitable. You have to understand. There are doctors, but they are busy. Why? Because probably they have a lot of workload. So आपको ये 50-bedded का concept लेके आना. And I can tell you, the moment you will bring this 40, 50-bedded, the most ethical and the most hospitable hospitals, I'm telling you this concept of 500, 400 bed. Anyways, these hospitals are not making enough money, so they will vanish. Plus, Gujarat in 2010 taught me one thing. The concept of group practice. I went to see someone in Baroda and that doctor was supposed to come to the airport to receive me. He didn't and he sent someone else. And when I met that guy, I said, he introduced himself and then he told me that he's a pediatrician. The person who was supposed to come to see me and he was a friend of mine. He was again a pediatrician. So he said that my friend was busy in the hospital, so therefore I came to pick you up. Both were pediatrician. I had never seen that. I had never seen two orthopedic surgeons, two pediatricians, two surgeons gel along. नहीं होता, India में नहीं होता. गुजरात में मैंने ये चीज आज से 15 साल पहले देखी. The concept of group practice, I for the first time in my life, I saw in Gujarat. When I say group practice, that doesn't mean one physician, one orthopedic surgeon, one surgeon. Of course, I mean that only, but two pediatricians working together. One is, going abroad for something or for some family or lesion, and the other one is taking care of his patients. The fraternity has to now stand united. If we are two orthopedic surgeons, I perform joints, I perform arthroplasty, and you're taking care of scopy and spine, of course, we can share the work, we can share the load, and we can make a big name, we can make a good name, and we can be more, हमारा जो credibility है वो ज़्यादा हो सकता है. This concept is gradually now coming up. This concept of daycare surgery, this concept of hospitable hospital is now coming up. Because at the end of the day, a person who is paying you so much, all he or she wants is at least some amount of hospitality, congeniality, and the most important part, empathy and sympathy. इंडिया के मेडिकल एजुकेशन सिस्टम से मुझे कोई शिकायत नहीं है. मैं आप लोगों को एक बात बता देता हूँ, मुझे कोई शिकायत नहीं है. Although I find it very stupid, I find it very weird, and I hope that things are improving now with the new education policy. Things should improve, but there is only one shikayat, there is only one problem that I have, that they don't teach. They certainly don't teach one thing to our medical students, and that is how to tackle a patient. Some of you might be feeling it weird कि ये क्या बोल रहा है यार, सारा ये तो पढ़ते हैं हम. नहीं, you work in a government medical college, you are studying in a government medical college, there are 700, 800, 900 patients coming in every day. You don't have time for anything. You have to just fill up the form, send the patient across. Okay, yahan jaiye, report le aaiye, ye le aaiye, wo le aaiye. In that effort, you stop learning the art of empathy and sympathy. The most important part is sympathy is you feel for the other person. Empathy, you put yourself in place of the other person and then you feel for the other person. ये चीज बहुत जरूरी है. मैं इमोशनल होने को नहीं कह रहा हूँ. I'm not asking you to be emotional with every patient, but what I'm telling you is that for whatever 5, 10, 15, 20 minutes you are with the patient, you have to make sure that whenever that patient leaves your room, of course you are supposed to give him the best of the best treatment, but he should be psychologically fit. He should be psychologically fine. He should be psychologically treated by you, because every disease brings some sort of I want to inculcate the art of the fact that every student should have 1% component of being a psychiatrist. अगर आप सामने, मैंने आपको पहले भी बोला था, इस दुनिया में वो मैटर नहीं करता कि आप किसी के लिए क्या करते हैं. इस दुनिया में वो मैटर करते हैं कि आप किसी को क्या महसूस कराते हैं. आप किसी को पैसा दे दीजिए, person might not be happy or might not be thankful to you, but you do something for that person, you make them feel special, you make them feel honored. That is, I think, the most important thing. India ke medical college mein ek hi problem hai, izzat nahi dete. Majority of the department, I don't know whether it has improved right now or not, but I never got respect from any of my departments, any of my seniors. We used to stand. Nobody has ever asked us any cup of tea. I think a cup of tea would not cost more than 5 rupees. And if any doctor, senior professor, AP, reader, lecturer, अगर कोई ये बोलते हैं हाँ ठीक है 5 स्टूडेंट आए हैं 5 चाय मंगा लो इन्हें 5 चाय पिला दो 1 बिस्किट खिला दो, I think that is all what we need. So this is what I want from you. We should change. We have to change. We will change. आप अपने juniors के साथ मिलते हो, a cup of tea with a biscuit may not cost you more than 10 rupees. What is 10 rupees? 10 rupees is nothing. आप अगर एक 10 रुपए की चाय किसी को पिला देते हैं, whether you know that person or not, whether you are sitting in your OPD and you are having a cup of tea, and मैं कह रहा हूँ मत पिलाइए, even if you are sitting in a big corporate hospital, you are the head of the department and the patient comes in, you are having a cup of tea, you don't want to leave that cup of tea, it's hot, पीते पीते आप लेंगे? Would you like to have another cup of, would you like to have a cup of tea? Of course the patient is not going to say हाँ sir 2 चाय मंगा लीजिए और बिस्किट. नहीं, कभी नहीं बोलेगा. बोलेगा नहीं डॉक्टर साहब thank you so much. Ice is broken. That patient is yours. वो बोलेगा यार इतनी रिस्पेक्ट कौन देता है मुझे? Please start giving respect to your colleagues, start giving respect to the fraternity, start giving respect to your juniors, start giving respect to the patients, start giving respect to the people around you. All those people who do their post-graduation from a government medical college, the biggest problem that they find while they come in a corporate setup is they don't know the dialect, how to talk to a patient. You are doing post-graduation from a government medical college. You are dealing with a lot of stress. You are dealing with a lot of patients. Every day there is a big OT list, and those poor people who come to a government medical college or a government hospital, you are dealing with them. So, आपके 3 साल के post-graduation में, you develop a dialect which is good for them. You develop a dialect which is good for them, and suddenly you enter into a Zydus, you enter into a corporate hospital, you enter into a any other corporate hospital, and suddenly you see people who are coming in their 10 lakh, 20 lakh, 30 lakh, 40 lakh cars, and if you will have the same dialect, if you will have the same amount of ignorance, and if you will feel कि अरे हम तो डॉक्टर हैं, बात कैसे कर रही है हमसे, ये भगवान है, भगवान नहीं है भाई. You have to understand that the other person who is coming to you, who is paying 500, 700, 1000 rupees as the consultation fees, also deserves some amount of respect. He deserves a good amount of time. That time is very important. You have to give him time. In your government institution training, you dealt with quantity, not quality. In a corporate setup, if you join that, you have to deal with quality as well as quantity. If you really wish to give quality to all your patients, you have to make sure that you cut down on your quantity. आप मत देखिए ना, you please don't see more than 20 patients a day or 25 patients a day. Please don't operate more than 2 cases. Elective, okay, fine, I'll do this on this day, this day, this day. People, I mean, I've seen doctors giving me excuses. There's a heavy workload. No workload is heavy. You have made it heavy. मेरे पे तो नहीं होता. I have never taken a very heavy workload. I do elective surgery, emergency. I make sure that I give it to other people. Elective also, I make sure that I space them well, because the sanity of the mind is very important. Because if you're not happy here, how will you focus on that surgery? So whatever you do, whatever minimal amount you do, you make sure that you do it in the best of your way. That is the most important part. This is my tenure of learning, honestly, which I learned. But at every single point of time, I would like to repeat again and again, again and again, again and again, that it is going to be a tough journey. It is tough. It was never meant to be easy. Nobody told you it is easy. The moment you entered, the moment after 10th class, you took a decision, ki, Papa, I will take biology. I'll become a doctor. I'll become a cardiologist. I'll become a surgeon or a neurosurgeon. On that very moment, you somewhere in the back of your head knew that ye glorified hai, glamorous hai, par aasan nahi. You will get a lot of respect. I totally understand and appreciate that. But that respect was there in our profession. We had a kind of it was kind of an obligatory respect. Aaj se 10 saal pehle, Dr. Sahab was the most important. Dr. Sahab was the most important word. Aaj nahi hai. Aaj, we are judged on the basis of our ratings. We are judged on the basis of practo. We are judged on the basis of some random guy posting on Facebook that there's a big Facebook group of 40,000 people, some random guy. How is your experience with Dr. Tushar Mehta? Please share. Anybody is open to write anything. Even if somebody doesn't know me or has not been able to take an appointment with me, will write shit about me. So at this moment, it is not an obligatory or a compulsory respect that we doctors are going to get. We have to earn that. How do we earn that? By being sympathetic and empathetic to the people around us. We have to focus on the quality, not the quantity, and it is the time to develop that tinge of micro-entrepreneurship. I'm telling you guys, if you are 2-3 people working together, if you have a 30, 40, 50 bedded setup, the expenses are low. I mean, if at all you find any time, you can mail me. I'll tell you the performer, I'll tell you the branding, how to do that. Any 40, 50 bedded hospital, if we have 5, 6 good hospitable hospitals, I'm telling you, this concept of going to a giant hospital and getting lost in over there, this will be lost. I'll share one more example. Just yesterday, I don't remember the name. I got a message on Facebook. Certain messages on Facebook, they don't come to your inbox. They go to the others and spam folder. So I was checking the others folder and I got a message from one student and she said that her relative, I don't remember, I think it was grandfather, he's COVID positive and he is having some kidney disease, some stage 2 or something, and he's COVID positive and he has to undergo renal dialysis and he's deteriorating and they're not getting a proper dialysis center or bed or whatever. So I said, these are 3 hospitals which are nearby to your place. I can maybe call one of them. Otherwise, I'm giving you a number. You can call one of them and you can arrange a bed over there. So that is something, it is not going to take more than a minute for me. All I had to do was just to call some person and I said that this blah blah doctor student will call you and please see to it what best we can do. This is only 2 minutes were allocated to this task. After 10 minutes, I got a message from her that, sir, because of this help, I got 2 different places. I got 2 different places, 2 beds in 2 different hospitals, and now we are deciding that where to go. And she said, thank you so much for being approachable and all those things. I said, no, that was no need to say thank you to me. Just make sure that if tomorrow you are a pathologist, you are a radiologist, you are something, and if I come to you and if I ask you that, you have to, will you help me in this? Please do that. She said, no, sir, don't worry, sir, I'll take care of that. I will make sure that it is a kind of a chain reaction that I create. The younger generation is, I will be very honest, the younger generation is very much actively involved in this. As you grow old, you have a family, you have kids, you have a husband, the moment you come to work, you actually bring that entire tension onto your work. This is the biggest problem. So you have to be free, you have to be liberal, you have to take the correct decisions in your life, whether in your personal life, in your professional life, because coherence is the word. So whether personal, professional, religious, spiritual, psychological, social, Dr. Shah was talking a lot about spirituality. I totally agree. It is very important. But what I want is a kind of coherence in all aspects of your life. If you are excelling in one aspect of your life, whether it is personal, religious, or spiritual, and you're not doing good in professional life, according to me, according to my mindset, you're not doing good. तो बैलेंस बना के चलिए, कोहेरेंटली चलिए, आगे चलिए और जिंदगी में सब कुछ आसान हो जाएगा. And make yourself happy, because staying happy is the only bliss that we have today. I think we can take some questions.
Thank you so much, sir, for such wise words.
Thank you.
Any participants would like to ask any question can type in the chat box.
Yeah, I think I can see one question. Walcow has asked, I think about leaving medicine every day and the feeling. Okay, see, you have to understand that एक हिंदी में एक शेर है, हालांकि सबने सुना होगा आप लोगों ने, कि किसी को मुकम्मल जहां नहीं मिलता, किसी को जमीन, किसी को आसमान नहीं मिलता। तो आपको शायद ये लग रहा है कि आपको आपका मुकम्मल जहां नहीं मिला है, जिस वजह से यू हैव रिटन दैट यू फील दैट यू हैव a feeling that of leaving medicine, but listen to me very carefully, that whatever, wherever, whenever you will go and you will do, at the end of the day, it is not going to be, happiness is something that has to come from within. तुम आज चले जाओगे इंजीनियरिंग करने या कुछ और करने, हो सकता है तुम्हें वो भी चीज पसंद आए. So what I would say, that whatever you have in your head, because I assume that you're doing MBBS right now, so whatever you have in your hand and head, please follow that. बोलते हैं ना कि जब कुछ हाथ में आ गया है तो उसको बेस्ट बनाना चाहिए. You have to come out as the best version of yourself. So I think that is very important.
Thank you, sir. So there's one more question. Could you please elaborate on MBA after MBBS?
I was just talking about that. I have worked a lot on this topic, that MBA, about the after the MBBS thing. A lot of people have done that. A lot of people are doing that. तो आपको ये भी बोलूँगा कि I know a lot of administrators in hospitals who are, I know one person, like she's an MSc ENT, and right now she's running one of the biggest hospitals in India. So what I would like to say, that there is no issue, there is no problem in doing MBA, and particularly in doing MBA in the management, particularly the second year subject is usually they take up management, HR management. So there is no issue in doing MBA in that. The only thing is that you have to understand that there are certain prerequisites for it. The first prerequisite is that you have to have a very clear bent of mind that you are going to be just in the management without any clinical acumen. मेरी बात समझ में, बहुत लोग ऐसे होते हैं जो ये बोलते हैं कि नहीं हम उसके साथ अपनी प्रैक्टिस भी कर लेंगे, and we will be seeing patients also, and we will be in the management also. That is not going to happen. Normally every corporate hospital has a fundamental hierarchy: deputy medical superintendent, medical superintendent, then senior superintendent, and then the HR head, and the medical director. So hospitals these days, they don't want MBA people as administrators. They want doctors plus MBA people as administrators. Why? Because if you're a doctor, it will be easy for you to gel along with the doctor. And if you're into administration, then of course you can run that, which is their wish from you. तो कोई बुराई नहीं है, बहुत लोग कर रहे हैं, बहुत लोग इसको करेंगे आगे. ये चीज एक बहुत अच्छी चीज है. मैं भी कुछ साल पहले, until last couple of years, I used to feel it's not that good a thing, but now I've realized it is a good thing. But the only thing is that you have to be very good in contact making. Number one. Number two, you have to be actually good at administration. So you have to be very, I would use the word, you have to be very enterprising. तो अगर आप नेचर से इंट्रोवर्ट हो, एंड इफ यू फील दैट नहीं, you don't like talking to much people and all those things, so don't take it. I mean, you have to be an extrovert, you have to be enterprising, you have to be good in making contacts, and the most important thing which I'd like to say in the end, that please do it from a good college. I mean, I've seen people who are doing MBAs after MBBS. Actually, आपको शायद आइडिया नहीं होगा, BDS के बाद बहुत लोग करते हैं. BDS के बाद, when they fail to clear MDS, or even if they clear MDS and they see that a lot of job opportunities are not there, BDS के बच्चे बहुत आते हैं MBA करने. तो आपको MBA अगर करनी है तो do it from a good college. Try for some business school. I don't know whether you have heard of it or not. ISB हैदराबाद है. अगर और ज्यादा आप करना चाहते हैं, LSB है, London School of Business है, London School of Economics है. तो मतलब आप करिए, बट ऐसा नहीं है कि अब आप पीजी, अब जैसे फॉर एग्जांपल आप पीजी करना चाहते हैं, तो आप, मैं आपसे पूछूंगा आप कहाँ करना चाहते हैं, बोलेंगे सर एम्स में करना है, KEM में करना है, मैं MC में करना है. तो ऐसे में बोलूंगा कि MBA भी ट्राई टू एम फॉर अ हायर कॉलेज, बिगर कॉलेज. So it's good, and people are doing it, and people are doing it really well. जुगल शाह ने एक और क्वेश्चन पूछा है, प्लीज एक्सप्लेन अबाउट एब्स्ट्रैक्ट थिंकिंग, पॉसिबली विद एन एग्जांपल. मैं अभी बोलता हूँ. द वन थिंग दैट आई सेड जस्ट नाउ about the MBA thing, Jugal, yahi abstract thinking hai. Till about 2013-14, I never had, I had never put MBA after MBBS as a good career option. I used to tell everyone कि क्यों करना है यार MBA, MBBS क्यों की थी, डॉक्टर बनने के लिए की थी ना, तो करो ना फिर अब उसको. The other student used to tell me, नहीं सर मुझे तो रिसर्च करना था, मुझे तो ये करना था, वो करना था. मैं बोलता हूँ देख भाई, 2014 तक मैं बोलता नहीं. If you have come to the medical profession, you have come to it for one reason, that you are supposed to be a doctor. No MBA, MBA and all, because they are just glorified, workers. That's all. A doctor, hai yaar, you should have some respect and all. But right now, what I'm seeing is a lot of capital. Capital se mera matlab paisa hai. A lot of capital flowing in our country, in our healthcare from abroad, and that is giving all other. The doctors are now getting less packages as compared to these administrators. So, with passage of time, if you're aware of the things which are going around you, then I think you are having a probable capability of abstract thinking. मैं इसको एक लाइन में और summarize करता हूँ जुगल, जो मेरा personal बड़ा favorite line है. You have to be alert, you have to be awake, you have to be aware. मेरी बात फिर से सुनना. You have to be alert of what is going on in your life. You have to be awake what is going on in others' life, and you have to be aware that what is actually required in our life. So if you're alert, awake and aware, you shall arise. So अगर आपके पास ये alert, awake, aware है तो आप arise करेंगे. और ये abstract thinking का एक बहुत common concept है कि आपको मैं एक बेसिक बात बोलूं, आप उसका gist निकाल लें, मैं आपको एक gist दूं, उससे आप उस चीज को extrapolate कर लें. So I think that is abstract thinking according to me. Scope in private practice versus corporate practice for the current generation of graduates. मैं एक चीज बिल्कुल clear बोलूँगा. If you will see my Instagram also, if you will see my Facebook also, yesterday or maybe day before yesterday, I shared one of the pictures of an article by one of the leading gynecologist, Dr. Bajaj. मैंने उनका एक article share किया था that corporate slavery should be stopped now. I will never ever advise you. Maybe you can join in. I mean, after your MD medicine or MS orthopedics, you can join in a corporate hospital maybe for a year or two. You can learn the finish, you can learn the finish, you can learn the art, you can learn the quantity quality concept, and then you have to start your own thing. I just don't want you people to be salaried for 10 years, 20 years. I don't want you to do that. You have to have that DNA of micro entrepreneurship. You have to develop that skill of managing other people, managing 5 people in the pantry and 5 people in the OT and 5 people in the sanitary department. You can hire managers. You can do everything. मैं हमेशा प्राइवेट प्रैक्टिस के फेवर में रहूंगा. कॉर्पोरेट में भी ईयर और 2, बट देन यू हैव टू स्विच ऑन टू प्राइवेट प्रैक्टिस. कोशिश करिए ग्रुप प्रैक्टिस, कोशिश करिए 30-40 बेडेड और 20 बेडेड से यू कैन स्टार्ट. This is what my advice is for the current generation always. There is one more question from Mehek. Mehek, मैंने आपको बोला, I cannot take names here, but one of the leading administrators of one of the biggest hospital in the country, she is an MSc-NT. She did her MSc-NT, she was doing good, but then suddenly she realized that she can do better in the administration. She did her MBA, and right now, and I told you, she's heading one of the finest chains of private hospitals in the country. So MD के बात कर रहे हैं लोग, MS के बात कर रहे हैं लोग, BDS के बात कर रहे हैं. Again, आप उसमें देखिए ना कि उसमें क्या मैटर करेगा. उसमें मैटर करेगा how skillful you are, ठीक है, how intelligent you are. At the end of the day, coherence matters ना. आप इंटेलिजेंट है तो आप किसी भी फील्ड में जाएंगे, आप अच्छा ही करेंगे, आप बुरा तो कर ही नहीं सकते. Dr. Kena ने पूछा how to keep balance between academics and activities. I think Kena, you are also doing it very well. So आप बस I'm that sort of a person. I will say that they should go hand in hand. They should go 50-50. Academics is something, according to me, आप कभी भी you can catch up on academics. Like अगर थोड़ा time आप if you're in a medical college and if you are arranging some online conferences, so I think I will give an advantage that I think this is more important right now. ठीक है, पढ़ाई का क्या है, सब्जेक्ट क्या है, कर लेंगे, आज नहीं कल कर लेंगे, कल नहीं परसों कर लेंगे. So I don't think that is that much important. I think being into sports, मेरा ऐसा मानना है कि sports में होना या extra curricular activity में होना, I think that is more important because पढ़ाई तो सभी कर रहे हैं ना, academics तो सभी कर रहे हैं, ये जो जितने भी subjects हैं ये तो सभी पढ़ रहे हैं, इसमें क्या नहीं है. So being into extra, I always appreciate people who are more into extracurricular activities rather than academics. Of course, I wouldn't want them to score less. अच्छे marks आ रहे हैं, ठीक ठाक marks आ रहे हैं, आप pass हो रहे हैं, that's good. But extracurricular activities I think is more important. And when I ask you to keep a balance, then it is prioritizing. Like if you are near your university exams, I think then your priority becomes academics. But if you are doing it right now, अभी आपके एग्जाम नहीं है और आप कुछ इस तरह की एक्टिविटी कर रहे हैं, आप कोई कॉन्फ्रेंस कर रहे हैं, आप स्टूडेंट एक्सचेंज प्रोग्राम में जा रहे हैं, आप कुछ भी कर रहे हैं, these things they nurture you well. एक इंसान जो होता है ना, मैंने पहले भी बोला, a human being is an outcome of two things in life. One is nature, one is nurture. Nature is what we are born with. जैसे मेरी अपनी एक नेचर है, मैं ऐसा हूँ, मैं ऐसा हूँ, मैं ऐसा हूँ. कोई बोलता है ना मैं एक्सट्रोवर्ट हूँ, मैं एंटरप्राइजिंग हूँ, मुझे गुस्सा आ जाता है. कोई बोलता नहीं मैं इंट्रोवर्ट हूँ, मैं बात नहीं करता, I am more of a shy person. So nature is something we are born with, and I don't think that you can change your nature overnight. आपकी जो नेचर है वो आपके साथ है, मेरी नेचर मेरे साथ है. बट द सेकंड थिंग इज नर्चर. नर्चर इज पालन पोषण. आई एम नॉट टॉकिंग अबाउट द नर्चर ऑफ पालन पोषण ऑफ योर पेरेंट्स. वो ठीक है, पेरेंट्स जो नर्चर करते हैं वो ठीक है, लेकिन अभी तो आप पेरेंट्स के साथ नहीं हो ना, कोविड में हो, वो एक अलग बात है. बट इन अ मेडिकल कॉलेज योर नर्चर मीन्स योर फ्रेंड्स दैट यू हैव द बुक्स दैट यू रीड, the places that you visit, the movies that you watch, the series that you watch. So nurture is something which is very very important in this period of your life, because I presume आप सब लोग 18 से लेके 25 साल के बीच में हैं. So you are malleable, you are ductile. आपको चाहे तो अपने आप को कैसा भी बना सकते हैं. इस वक्त पे आप ऑनलाइन एक्टिविटीज कर रहे हैं, आप स्पिरिचुअलिटी भी सुन रहे हैं, आप एंटरप्रेन्योरशिप भी सुन रहे हैं, आप सब कुछ सुन रहे हैं, आप यू आर ओपन टू ऑल व्यूज. इससे अच्छी बात एक मेडिकल स्टूडेंट में और क्या हो सकती है. मेडिसिन तो सारे पढ़ लेंगे, लेकिन दुनिया को सुनना, समझना और अप्लाई करना, मेरे को लगता है कि वो एक बहुत बड़ी बात है जो कि आप लोग करते हैं. मुझे बड़ा अच्छा लगता है इस चीज. Some companies are providing business coachings for people who don't like to do MBA. Vijesh, I know Bindra very well. See, you have to understand that मैं कोचिंग वर्ड जो है ना, मेरे को ऑनेस्टली आई हैव सर्टेन इश्यूज विद कोचिंग. लाइक coaching is something which is, I mean, when I say coaching is something that I feel it should be used only in sports. मेरा ऐसा मानना है. हमारे में मतलब I don't think that I should be called a coach because I'm not a coach. Because coaching is something जो सिर्फ स्पोर्ट्स में होती है. एक इंसान है जो आपको सिर्फ कोच कर सकता है, वो खेलने के लिए कर सकता है. जिंदगी में आप क्या कर रहे हैं, हम we are just, you know, we can be called a guide or maybe an informer or maybe an organizer. I mean I use the word organizer often. I don't want to be called as an educator sometimes. Teacher तो मेरे को बिल्कुल नहीं पसंद है. Anybody tells me, you know, sir, you are a teacher. और teacher क्या होता है? I cannot be a good teacher because there are many people who are senior to me and they are very much well formed and well informed about the subject than me. I'm more of an organizer. I organize the subject to you. I organize orthopedics to you in form of certain clinical cases, and I make it into the most palatable form. You listen, you hear, you feel them, you feel good, you go back home, you revise, you clear an exam, and that's over. So बिजनेस चलाने के लिए या हॉस्पिटल चलाने के लिए या ये सब चलाने के लिए कोचिंग इज नॉट रिक्वायर्ड. आई मीन कोचिंग नहीं चाहिए. एक इंसान जो अपने हालात से सीखता है वही सीखता है. तो आप पढ़े लिखे होने चाहिए और आप मेहनती होने चाहिए, एंड यू शुड हैव समबडी, लाइक आई वुड लाइक टू मेंशन अ वर्ड हियर, मेंटोर. There is a very high amount of respect for somebody called mentor. Like in a surgical branch, surgery, orthopedics, OBGYN, ophthalmology, you cannot excel without a mentor. You have to have a mentor. आपको एक आपका वहां पे एक alleged भगवान होना चाहिए आपका, जो आपका हाथ पकड़ के आपको बताए कि ये इंसिजन है, ये अप्रोच है, ये मसल आएगी, ये नर्व आएगी, और सुनो ये आर्टरी आएगी, हाथ हटा लो. So in a medical, like my father used to say, in a medical branch, patients are your books and wards are your library. But in a surgical branch, patients are not your books and wards are not your library, because majority of the learning has to happen in the operation theater. And in an operation theater, you whether you know the anatomy or not, but the moment you give an incision and blood comes out, life goes for a toss. So there has to be somebody sitting behind you or standing behind you, which you must be aware of कि चल यार कोई बात नहीं, अगर एक आधा कुछ कट भी गया तो ये संभाल लेगा. Or maybe he should be giving you a kind of a direction in the beginning कि ऐसे करो ऐसे करो ऐसे करो. So mentorship I think is a better word rather than business coaching. And मेरा ऐसा मानना है कि mentor ढूंढने से नहीं मिलता, ऊपर वाले ने mentor fix किए होते हैं. Mentors जो होते हैं ना, like I have a couple of mentors. Like in my education there is a mentor, in my business there is a mentor, in my profession orthopedics there are a couple of mentors. So वो ऊपर से आते हैं, वो मुझे भी नहीं पता वो मेरे mentor कब बन गए. I never knew that when I gelled along with them. I mean, I still remember that was my first day of my PG. I joined DNB Orthopedics, and the academic head of the department. He bashed me like anything, that you were supposed to come at 10 a.m. and you are coming at 11:30. I said, sir, I had gone for medical. He said, first you are supposed to come and join the department, and then you could have gone for the medical. Now that man, he was the reason why I cried on day one, and that man is one of the, I would say, not a friend, but yeah, kind of a friend, philosopher and guide for me today. तो ये धीरे धीरे अपने साथ हो जाता है. Don't worry, आप उसकी चिंता मत करिएगा. I think we have one question on YouTube पे कोई question है?
Yes, sir, there is.
Yeah, YouTube पे question है. Dr. Suresh ने पूछा है, and I think it should be spoken about. Depression is more among students during exam. Your suggestion from them, sir, please. See, I will tell you one thing. Depression, I'm not a psychiatrist, but this is my viewpoint, that depression is something, if you are a medical student and if you feel that you are depressed during your exam, I wouldn't call it a depression. उसे हम एंजाइटी बोल सकते हैं, उसे हम नर्वसनेस बोल सकते हैं, उसे हम न्यूरोसिस बोल सकते हैं, but I don't think it should be called as a depression. Because depression में, of course मैंने बोला I'm not a psychiatrist, but I think endogenous depression means that, it has to be a feeling of selflessness, worthlessness, and a low mood almost whole day. वो बोलते भी ना, the activity that was earlier pleasurable, you don't find any pleasure in it. So depression is a very discrete word. We should not use the word depression just for the fact कि exam में आपको डर लग रहा है. मतलब उसे हम डिप्रेशन की डेफिनेशन ना दें. इससे ना डिप्रेशन जिन लोगों को है वो बुरा मान जाते हैं कि अरे यार आप ऐसे कैसे बोल रहे हो. So what I personally feel better is that even if you're in your exam days, if you're having some sort of tension or nervousness or anxiety, or you're irritated or whatever, you have to just make sure that whatever you have done in the past, you are reaping the fruits or maybe the bad fruit of that thing today. आपने पढ़ाई नहीं करी है तो आज आप डिप्रेस हो रहे हैं, आपको लग रहा है कि आप डिप्रेशन में जा रहे हैं. So that is just an outcome of what you have done in your previous months or days or weeks. So first of all, prevention is better than cure. So first of all, how to prevent it? Prepare in time, read in time, revise in time, remember in time. Make sure that you follow your 10 years, your books and your notes and everything in time. दूसरी बात ये है कि let us say there are 48 hours left for the exam and you feel that you're getting depressed, although that is just a pathological anxiety, then at that particular moment you have to be very, very mentally strong here. Like दुनिया में there is a concept of IQ. I'm sure everybody has heard of, बोलते हैं ना इसका IQ level ये. ऐसे ही there is a Goldman करके एक author है, उसने बोला there is a concept of EQ, emotional quotient. So your IQ may be high, you're very good in studies and you're very intelligent, your IQ level is very high, but at the same time your EQ should be high. You should be emotionally very strong here. So at times I used to feel, I feel the same. मेरे साथ अभी भी होता है, कभी-कभी मुझे लगता है that things are not in my hand. There is some work that I want to get done and there is something that I want to achieve, but it is not happening, and maybe I have given the best of it, and I start feeling that it is the end of the day or end of the life and all sorrows and miseries and everything. And then I make sure that the next morning when I wake up while brushing my teeth, I start feeling, first of all I start having the gratitude and thankfulness to God for whatever I have right now. मुझे कुछ चाहिए, वो मुझे नहीं मिल रहा है, उसके लिए परेशान होने की बजाय मैं बोलता हूँ पहले शुक्रिया अदा कर लेते हैं कि आज जो है वो रात खराब होती है, I understand, but next morning I feel thankfulness कि चलो जो है सो है. दूसरा, then I start analyzing कि क्यों नहीं वो मिल रहा है, क्यों नहीं हो रहा, कैसे. So whenever you are having any sort of stress in your head, just start thinking about it, how to sort it today and how to make sure that it doesn't happen tomorrow again. So if you're feeling pathological anxiety, then first thing is क्यों हुआ ये, because पढ़ाई नहीं करी है. दूसरा, इसको कैसे नहीं होने दूंगा कि आगे पढ़ूंगा. अभी क्या करूं, अभी whatever best of the time that I have to utilize it. I don't want to fall trap into the vicious cycle. पढ़ाई नहीं हुई, टेंशन हो रही है, वक्त बर्बाद हो रहा है. पढ़ाई नहीं हुई, टेंशन हो रहा है. So regret on a wasted time is more wasted time. Always remember, बीते हुए समय पे पछताना और समय को बिताना है. तो इसीलिए make the best use of it, stay strong here, everything will be sorted. I don't think there will be any issue.
Thank you so much, Dr. Tushar sir. We are really grateful for the time and the effort you took to share your thoughts and experiences. Thank you so much, sir.
Thank you so much. Pleasure is all mine. And As I always say, these kind of conferences and these kind of initiatives by the young enthusiasts of the country, it is very much required. I'm more power to you guys and my heartiest blessings for you all. आप लोग जिंदगी में सब आगे जाएं, अच्छा करें. मुझे खुद बहुत अच्छा लगता है सब देख के.
Thank you so much, sir. Thank you so much.
Thank you.
I would also like to thank all the speakers for such a remarkable lecture. We are very grateful to have you here today. I would also like to thank all the participants for being such a wonderful audience and attending the first half of the session. Our second half of the session of the keynote speaker is at 4 p.m. I would request each and every participant to join in at 3:45 p.m. We have two more speakers in the second half. They are Dr. Hitesh Chawda and Dr. Sanjeev Phat. Thank you.